To order. Thank you. Can I get a roll call?
Commissioner Beeman? Here. Commissioner Hodge?
Here.
Commissioner Labar?
Here.
Commissioner Light?
Present.
Commissioner Machieski?
Here.
Commissioner Robbie? Commissioner Sanders?
Here.
Commissioner Scott?
Here.
And Commissioner Somerville?
Here. Okay, and I'm going to move on to public participation. At this point in the meeting, members either in the audience or online have 1 minute to address the body. Do we have anybody in the audience that would like to participate? Okay, seeing none, do we have anyone online? Okay, seeing none, I will move on to report from the county administrator. Do we have anything?
No report this evening.
Okay, moving on. We do not have a report from the Board of Commissioners liaison. And so I'm going to move to discussion item A. We will have a presentation from Jeremy Lapidus from the Washtenaw County Health Plan.
Great, thanks so much. Give me a minute to just get my screen set up here. All right. I think that should come. All right, great. Thanks for having me here. My name is Jeremy Lapidus. I am the Executive Director of the Washtenaw Health Plan. I've been the director of the health plan for about 3.5 years. No, 4.5 years, sorry, COVID time. My apologies to Commissioner Hodge and Scott. They saw this presentation a couple weeks ago at the Board of Health. It's a very similar presentation. My goal here is to provide an overview about the Washtenaw Health Plan for some of the newer commissioners, and then talk a little bit about our finances and talk about the restarting of Medicaid renewals, which have not happened in the last 3 years since the pandemic, and they're starting again this spring. All right. I'm going to go to the next slide. Hold on one sec. All right, there we go. So the Washtenaw Health Plan is an independent 501c3, but we operate very closely with the Public Health Department. We lease all of our employees from the county and the Public Health Department and consider ourselves a healthcare access arm of the health department. We have our own board of directors at the health plan. And our mission is to help low-income and uninsured people access high-quality healthcare and health promoting services. Since its inception, the health plan has been a partnership between Washtenaw County, the Washtenaw Health Department, Michigan Medicine, and Trinity Health since we began in 2002. So again, this is just a presentation outline. I'll talk a little bit about our services and impact. I'll talk about our finances, and then talk about the Medicaid renewals, which are going to begin for the first time since 2020. But first, I'd like to start with the client story, just to give you an example of the kinds of things that we do. So PA is a 29-year-old Afghan refugee. She arrived in November of 2021 with her son, who is 10 years old, and her infant son, and her brother. She was resettled by Jewish Family Services, which is our local agency that helps with that, who helped them find an apartment, helped them get health insurance, and helped her brother get a job. The family went to the health department WIC office to get the help for food for the infant. And it was discovered that the infant didn't actually have health insurance. And this is one of those things we see a lot, is people think they've signed up for health insurance. But in this case, it was due to some weird name change that happened through the immigration process, by which the infant didn't actually get on health insurance. And so we get a lot of referrals from the health department, people that come in and need help accessing health insurance. And this is also an example of like how people come to us. We are the safety net when the existing systems do not work as they're supposed to work. So we helped this infant get health insurance. We helped them get Medicaid, and then help them understand how to use this health insurance. They've never had health insurance before. They weren't connected to a doctor, so we connected them to a doctor at Neighborhood Family Health Center in Ypsilanti. And we connected them with dental care. They had never had dental care before. And we used we worked with My Community Dental Center, which is located in the same building as the Neighborhood Family Health Center. And connecting them didn't mean just, making an appointment for them, but arranging transportation, making sure there's a translator on site, calling to make sure the transportation arrived and they got there. And so this was a family that doesn't speak any English. And so helping them through this process wasn't, it's not as simple as just here's a phone number, give them a call. It's an in-depth service. So we also helped the 10-year-old enroll in school for the first time and teach the 10-year-old how to take the bus and help get the family furniture for their apartment. And so you can see that we not only help people get on health insurance, but make sure that they know how to use it and they know how to access healthcare, but also help with these additional things which might get in the way of them taking care of their healthcare, such as enrolling in school for their kids or getting furniture, so that they can really live healthy lives. So their entire family now has health insurance. They're connected to medical care. They've had their dental needs addressed. They're financially protected should anything happen in the future that they need medical care. Medicaid is going to reimburse the providers for the health care they receive. And they got a more stable life, and they're able to create a life for themselves here in Washtenaw County. This is our impact model. You can see on the left side there, we help people access healthcare by navigating health insurance and public benefits, connecting to physical, mental, behavioral health, and dental services, and we resolve barriers to care such as unpaid bills, transportations, or language issues. We're available on demand. Anyone can come walk into our office at from 8:30 to 12 or 1 to 4, Monday through Friday, proactively, and we have staff who speak Spanish, Arabic, and French. We offer long-term holistic relationship-based care. And the result of our services is greater health insurance coverage in the county, greater access to care, better trust in the healthcare system, better overall health, and better coordination amongst community partners and more reimbursement to our healthcare providers in our county, and ultimately, a more responsive system of care for low-income individuals. So in Washtenaw County, there still is a substantial unmet healthcare access needs. There are about 19,000 uninsured residents in the county. We estimate, and this hasn't happened since the pandemic, and I'll get into this in a little bit, that about 7,000 residents are going to lose Medicaid every year, even though that they're still eligible, just because of the renewal process, and this is what's called churning. And then about 37,000 residents estimated to have avoided healthcare because it was too costly. I'm going to talk a little bit about our community impact. We provide in-depth services to about 6,000 county residents every year. And on the left side, you can see we provide a health plan for 2,500 members. And these are people who do not qualify for any other health insurance. And so a lot of folks, if they don't qualify for Medicaid or Marketplace, we enroll them in the Washtenaw Health Plan, and they're able to get healthcare services through that. There's also our health insurance navigation services, which are enrolling a lot of people in Medicaid and Marketplace coverage. We help another 3,500 individuals enroll in health insurance. And so this is just the in-depth services that we provide. We answer countless phone calls every day when people have quick questions about, hey, I work 3 jobs. I don't quite know how to report this on this DHS form, or I need to change my address. How do I figure out how to do that? That is something we do, but we're just not tracking it because we want to spend time helping people. A little bit more about kind of the other services we provide. We help 500 people with healthcare navigation, making medical appointments, getting to medical appointments, help resolve Department of Health and Human Services issues such as address change or reporting income changes. I help people, 250 people with Medicare. We helped 600 people with food assistance applications. This has been particularly high recently for folks who food assistance applications can be quite challenging, especially for folks who don't speak English. So we've been helping a lot of folks in Spanish with food assistance applications. We also have our dental fund program. The county allocates $20,000 a year for dental care, and the Washtenaw Health Plan administers that fund through the My Community Dental Clinic. Last year, we helped 150 people access that. This year, we've already, in the first 3 months of the year, or 2.5 months, already helped over 150 people access that. So we are really on track for that. Dental care is still a huge need in the county. We also help with community-wide coordination. We have our advisory committee where we help inform providers about different changes to health insurance. We have community health workers that are connected through the My Community Care program, which is a collaboration of 12 organizations across the county to provide care support for individuals with complex care needs. And then we also have an Alianza Washtenaw Coalition, which is coordinating health services for the Latinx community. So I want to talk a little bit about the financial impact. Health insurance has been shown to improve not only the health of residents, but it also protects them from medical debt and lifts people out of poverty. And we estimate that through our work to get more people on health insurance, we're bringing $10.5 million into healthcare providers in Washtenaw County each year. And that's in addition to the funding that CMH gets through additional Medicaid enrollment. All right, and this is the fun slide because the Washtenaw Health Plan is going to change its name to the Washtenaw Health Project. You can see our new logo, our new colors here. This is really just recognizing that since the Affordable Care Act in 2014, we've changed to be more than a health plan, but really helping people navigate all sorts of health issues and healthcare access issues. We're still going to have our Washtenaw Health Plan for the 2,500 residents, but this is just, it's a rebranding and it's really exciting. And so that's going to happen in the next 2 to 3 months. Okay, I'm going to talk a little bit about our finances. Our fiscal year 2023 budget, we're projected to have $2.4 million in revenue. About a third of that comes from the county. Another 30% comes from grants or other income. About 25% or so comes from the health systems. And then we have a Medicaid match, which we get through the partnership with the health departments, about 15% of our funding. And then our expenses are about $2.6 million a year. Most of that's towards program staff, about 50%, or to 35% towards paying for medical services for our health plan members. And so you'll notice there's a little bit of a gap there. There's a $200,000 deficit. When I took over in 2019, that was a $1.2 million deficit. That deficit was created as a result of changes to the Affordable Care Act funding. And we had a significant fund reserve at that time. And so we had a conversation with our core partners, the county and the health systems, about spending down the fund reserve, which was at $6.9 million in 2015, to a more reasonable amount for asking for more funding. We are pretty much now at that point where we had $1.9 million in our fund reserve at the end of this past fiscal year. And you can see the projections there. We're projected to go lower in the next couple of years. So we've had a request out for increased funding and really want to thank the Board of Commissioners for increasing the Washtenaw Health Plan funding through the Human Services Partnership funding for $200,000 for 2 years. That's been really great. And we've also been supported by the health department as well. And with that support, we've really been able to say we're on okay footing right now. So that's been great. And thank you very much. We've had requests to the health systems to also increase their funding. Recently learned that Michigan Medicine has said that they're going to hold their funding constant for this year. They do contribute $200,000, but continue conversations for future years. And part of the reason they gave is that they're making a big investment in Ypsilanti right now, and they want to evaluate how everything shakes out. So hopeful to engage them in those conversations as their investment in Ypsilanti moves forward and as our need moves forward as well. I have a meeting with Trinity Health later in about a week and a half where I'll hear from them a little bit more about what they're thinking. All right, so Medicaid renewals, they're starting for the first time since 2020. And this is a process by which anyone who's on Medicaid in Washtenaw County has to submit a letter that says, I'm still eligible for Medicaid. And here's what I make, here's my income, here's the proof of that. Since 2020, Medicaid enrollment has grown by about 30% in Washtenaw County. It used to be about 53,000, now it's 70,000. And many people are going to need to either fill out these renewals or they're going to need to move to marketplace coverage. Since wages have increased a lot over the last few years, people may not be eligible for Medicaid anymore. So this is going to create 70,000 people over the next 14 or so months that are going to need to do something with their health insurance. Now, I'm hopeful that many of these people will be renewed successfully and easily. The state has a way of processing some folks' applications through looking at some of their own data and just simply renewing them. But we know from past experience that this is not going to be smooth for everybody. And it's going to be a lot of work for the Washtenaw Health Plan and for all of us here. So a little bit about the timeline. Medicaid renewals are starting now. They're sending letters out saying, you're going to have to submit your Medicaid renewal soon. We're seeing those letters. The Medicaid renewal packet won't start until May of this year. And then the first date that someone could lose health insurance would be July 1st of this year. Here's a map of folks on Medicaid in Washtenaw County with a blow up of Ann Arbor and Ypsilanti. And you can see that the darker red areas are the places where there's a higher proportion of folks who have Medicaid. And this is overwhelmingly in the eastern part of Washtenaw County in the 48197, 48198 zip codes. And when I think about what does systemic racism look like, this map shows me what it looks like. This is Medicaid renewal process is going to disproportionately remove people of color from health insurance. And the Washtenaw Health Plan is going to work to counteract that policy of the systemic racism that exists here. And really commend the Board of Commissioners for their work against this and their declaration in I can't remember, June of 2020 around this. So what can you do? Right now it's spreading the message to county residents. We need to make sure that everybody has their addresses updated with MDHHS, who processes Medicaid renewals. We need to make sure that people are responding to mail they receive. If they're no longer eligible for Medicaid, the marketplace can be an affordable option or employer insurance. And if you have questions, you can reach out to the Washtenaw Health Plan. I've also noted here that extra SNAP benefits came to an end this month. And so that is something we're seeing a lot of at the health plan, though we don't deal with it directly all the time. People are needing food right now. And so that's something that's related to the public health emergency and COVID, which you may also be hearing about. All right, here's my contact information, the health plan's contact information, and thanks so much for your time and look forward to discussion and questions.
Thank you so much. So I'm going to go in the order that I saw hands go up. So I'll go with Commissioner Hodge, Commissioner Sanders, then Commissioner LaBarre to start, and then Commissioner Robbie, and then Commissioner Machewski.
Thank you, Madam Chair. Thank you, Jeremy. This was even better the second time around. I appreciate you being flexible and moving your schedule around because I know we had to reschedule you from before. I wanted to talk a bit about a lot of what we discussed last year when you presented, that when we look at this particular issue, it's one of the ones that we look at, and I feel like we could solve this one if there were enough resources. I think that if the health plan had the resources that it needs, and I think the Board of Commissioners, we stepped up and we did our part last year by allocating the additional $200,000. But we find ourselves in a situation where we could have a county where everybody has access to health insurance if they would like it. Do you think that's fair to say, if you were well resourced enough?
I think that's fair to say. And, certainly not everybody wants health insurance, but, we have a system in place whereby everyone could have access to health insurance if they want it, if we were well funded enough.
So I would say with the additional allocation we made last year, what additional partnerships would we need to be able to get to that point for the health plan? or the health project, since that's going to be the new name.
Yeah, the Washtenaw project. Are you asking about a funding amount that I would need? Or
No,
are you
no.
asking about different
I'm
partners?
thinking about, partnerships. We've talked about the health systems. And we could talk about the letter that we sent the health systems to. But what would additional partnerships have to look like for us to be in a space where that's a reality and not just a goal?
Yeah, so I think, there's partnerships at the, funding level and the larger level, certainly with the health systems. We would look to increase the contributions, but also just our collaboration there. We've also talked about partnerships possibly with different pharmaceutical or different pharmacies. We have we provide about $250,000 a year of medication to our members. And so I'm not sure if any pharmacies would be interested in partnering with us. But I do think we also need to have some more grassroots partnership through the health plan and do more outreach. And that's something that, frankly, not been able to do because it's hard to plan to do that if you don't have the funding in the future to do that.
So if we were more successful in bringing our hospital system partners on board for even greater partnership, maybe we could do more of that.
I think so.
Okay, that's a fair thing to say. Okay, could you talk a little bit about what the community benefit might look like if we had all of those partners at the table? Like, how might the community look different?
I mean, so I think that, we would be able to get people into healthcare easier. So we might be able to prevent hospitalizations, emergency room visits, or medical debt. And the way we work as the Washington Health Plan is we not only get people into healthcare the first time, but we work through issues with them. So we are systematically improving the healthcare system as we are helping our members use it. So we're helping folks who are low income use the healthcare system and providing this response to them so that they're able to then more tailor their services to the low income community.
All right. Thank you, Jeremy. Thank you, Madam Chair.
Thank you. Commissioner Sanders.
So I saw the map that you put up. I'm still always curious about the rest of the county. So the western side of the county, what are their needs and how,
Yeah.
because of where you're centrally located, I just always wonder what happens. We never seem to see the dots on that side of the county. I also wanted to ask you about your dental partners. Who do they include? And I think my last question for you would be how could your agency attempt to sort of put itself out of business, if that makes sense?
Sorry, I didn't hear that.
Or minimize exactly the services that you're doing? What efforts could your agency do to help not be needed so much? Does that make sense? Not trying to
Yeah, I
put
got you.
people out on the unemployment line, but
Yeah, I mean, I wish we
how
didn't
do
have to,
you-
I wish we didn't have to exist. It'd be really nice if everyone just got health insurance and it was easy to access and there are no questions about it. Okay, so I'll try to take questions in order. The western part of the county, that is something we've worked with a couple agencies. We work with Faith in Action and have a relationship with them. So usually the way it'll work is they'll give us a call, say, I've got this question, and then we'll help them answer it. I didn't talk about this, but we do a fair amount of training of other case managers throughout the county. So Manchester Community Resource Center, I know that's more to the south. And so to try to get at some of those more rural locations and access those places where we're not as centrally located. But we're available via phone, or via email, and obviously walking in. So a lot of times folks will call us or email us and we'll be able to respond that way. Second question was dental partnerships. We work with My Community Dental Center, which is located out of the Hobb Building in Ypsilanti. So that's our main partner there. I do have a conversation coming up with the U of M Dental School. It's not a formal partnership that we have with them, but certainly we'll refer a lot of people there. And I am, excited that Medicaid at the state level is going to be increasing its reimbursement for dental care, as well as going to start covering crowns and root canals for adults, which they hadn't previously done. Many dentists around the area hadn't wanted to accept Medicaid because they couldn't provide good dental care because these services weren't covered. And so I'm hopeful that I think these rates go into effect on April 1st, but we'll start to see more dentists accept Medicaid in Washtenaw County. But it's really a big need, and I'm not sure we have enough providers that accept Medicaid currently.
So let me interject and say, I just had an opportunity to tour the health services at Washtenaw Community College, and they do cleanings. So that was one of the reasons that I asked, their dental hygiene program
Yeah, I would be interested.
does cleanings, and then if there's something more that they see, they then attempt to refer them, somewhere else. And so I'm just saying, that's a possible opportunity to help you stretch your resources.
Yeah, thank you. No, I would welcome having a further conversation with them. All right, and then what are we doing so that, people don't need to keep on coming back to us, is what I heard. So every time we enroll someone in health insurance, we try to teach them how we did this and teach them how to do it the next time themselves. And so there are a lot of people we enroll in Medicaid or Marketplace that come to us and they don't need to come back to us. And so that's our goal. But, there are some folks who this is really confusing for, and even if we're spending time teaching them how to walk through this process, a year goes by, they, forget about it. And how do I do this? I know this person helped me last time. I'm just going to come back there. And I'd say that the other thing is we are trying to train other organizations on doing what we do. But, some of the way I think about us is we're the kind of the tertiary care medical center of health insurance and healthcare access. And so on some level, we are the experts here that folks will come to when they have questions about health insurance. And so we're going to be needed. But yeah, I would love it if, we were able to fan out and have others be able to have this level of expertise when, if we could improve our systems so that we didn't have to do this kind of renewal process in a cumbersome way. But that will take some state level advocacy.
Commissioner LeBar?
Thanks, Chair. Jeremy, thank you for the presentation. You gave an expedited version of this to board leadership last fall, and it seems to largely, comport with that. You talked about, I think, $2.6 million total and a gap of about 200,000. If the county and other entities don't fill that, does it get filled? And is that all coming out of your reserves?
That is coming out of our reserves. It doesn't get filled. We are looking for grants and trying to fill it. So we're not sitting idly. But it doesn't get filled, and it will, for these next couple of years while we've got the county funding, it seems okay. But looking out a few years, the gap widens.
That policy decision to have the health organization fill it from those reserves, was that basically as a result of Medicaid expansion that the issue was sort of settled in the short term?
Yeah, so Medicaid, it was expanded in 2014, and the funds that funded the health plan came through the state. They were called DISH funding. That went away. And so that created this budget deficit. We reduced our staffing and expenses, but to the level where we needed them to be.
Oh, go ahead, please.
And I was going to say, and then that, agreement to let's spend down our fund reserve until we ask for additional resources was a short-term solution. And we've frankly been able to extend our fund reserves in large part because of our partnerships with the county.
We've had Medicaid since the late 60s. It's a federal program that can have 51 different iterations at the states and such. I don't think there's any way you can ever, any organization in your position can ever stay ahead of the curve in terms of connecting people who could be on Medicaid to Medicaid year in, year out without some level of change within the program or change within the process to get on and stay on. Is that roughly fair?
Not sure I understand what you're saying.
When Medicaid expansion came through, that changed the funding
Yes.
question. But on a year-to-year basis, in terms of the signups, especially if somebody's new to enrolling in Medicaid, how much does that change on a year-to-year basis? The process?
Yeah, I mean, the process usually has little tweaks here and there, but we've always got to stay up on these different changes that are coming. And, you know, our staff who have been there 20 years are always saying to me, I'm still learning new things. And it's really a testament to the culture of sharing and learning that we have at the organization that we're able to stay on top of it.
And I think you've more eloquently answered the question I sort of haphazard throughout there, that you're always responding to those changes. And that pressure never sort of goes away. It's never sort of fixed and set. I'm open, Chair and colleagues, to some level of back channeling with the health systems. And if need be, something formal at the board, asking them to remain, you know, in that gap as they have in the past, because I don't think we can let this slide. And so that's where I'm at. But Jeremy, I appreciate the presentation and the work you do and sort of connecting the dots here for us. Thank you. Thanks, Chair.
Commissioner Hodge.
Just real quick response, and I want to jump in front of everybody. So I appreciate you saying that, Commissioner Labar. At the beginning of the year, I sent a letter to the health systems encouraging a conversation about a deeper partnership. We didn't receive a letter back. Then we did get a letter back from one of them that didn't necessarily seem like a direct response to the letter that we sent. So we're going to have to follow up and more specifically. And I'd appreciate your support on any potential back channeling or other way that we want to engage with them. But we have reached out. We'll just have to, you know, make the community impact so much more appealing than, you know, whatever finances they're looking at. Thank you.
Perhaps we should lean into some of our friends in Lansing to help us with that. Okay, Commissioner Robbie.
Thank you, Madam Chair. Appreciate it. Thank you for your presentation. I think we've had some really good questions already. I do have a few myself. Obviously, the work that you do and the services you provide are critical to our community. And when I was commissioner and, you know, before I served in the state legislature, we went through this transition. And I remember when the dish funding issue came up. And in fact, I had just Googled it right before you explained it to Commissioner Labar. The administrator can attest to that because I'm sure he's watching what I do on my computer. But the issue that created was, of course, there was a lot of advantages to the expansion, but it created this shortfall within the health plan, which was a pretty specific issue for the health plan. But obviously, it was good that we were covering more people in a broader sense. And so I remember the conversation. I mean, you showed the graph, and I was like watching, like, oh, that's like when I left while I was in the legislature, and now I'm back. But I remember the conversation being at the time, we're going to draw down fund balance to cover this. And so it's just interesting to see that now in reflection after the last 6 years. I guess my question for you is, can you said, I was listening on my way in. I'm sorry that I was 10 minutes late, but I was listening to your presentation. The number of people currently that don't have health insurance in Washtenaw County was, I believe can you repeat that number?
Yeah, it's about 5% or so. And I can't remember what that number equates to.
Okay, so, but you know, the number of people in Washtenaw County is about 5%. Those are people that are not covered by Medicaid. They're not covered by the health plan currently. They don't have insurance. How long is the wait list to get on the health plan?
So this is something that's different. There is no wait list to get on the health plan now.
So anybody can just sign up if they want to?
Well, you have to be eligible for.
Of course, yeah,
Of
but
course.
anybody that's eligible can sign up.
Yep, and yeah.
And so the 5% that don't have health insurance, are they ineligible for the health plan?
You know, my guess is many of them will be eligible for Medicaid, but haven't signed up for it. You know, there certainly are going to be some that are eligible for the health plan, which we would love to enroll in the health plan, but my guess is most of them would be eligible for Medicaid. And then some might not be and choose not to have insurance.
Of that 5%, you mean? But anybody that wants health care can get it through the health plan.
Yeah, we will help anyone get help. That's what we do. When someone comes in, we ask them some questions, you know, what's your income, and trying to figure out what they're eligible for, and then help them enroll in whatever health plan that they're eligible for, and that makes the most sense for them.
So who's doing the outreach to the 5% of people that don't have healthcare right now?
You know, I would love to be doing more outreach than we're able to do right now.
Okay, thank you.
Commissioner Machewski.
Thank you, Madam Chair. You talked about Medicare redetermination or the renewal process that you're going to be going through. Do you have any kind of projection as terms of how many people you think are going to lose Medicaid coverage through that process?
Yeah, so, you know, estimates vary, but it's anywhere nationally, they say 5 to 13% of people on Medicaid will lose it. So, you know, if there's 70,000 people here in Washtenaw County, that's going to be 3,500 to 12,000 or so, maybe a little less. But I don't know, and hopefully with our efforts, it will be lower than that.
And for people that you encounter that are determined to be ineligible, you will be assisting them through the marketplace to sign up that way if
Yep,
they
either
choose to do so.
marketplace or employer insurance will be the two places we'd most likely look.
I'm curious about the community health worker in the community, the community care program.
Yeah.
I had a conversation with our public health officer recently to talk about the work that they're doing with community health workers. Is there any synergy with the work that they are doing, or is this a separate project?
It is a separate project, but we work very closely with them. So Washtenaw Health Plans had our community health workers since 2017. And our community health workers focus on folks who have had more complex medical needs and need a little bit longer term relationship case management kind of thing. But we refer people to the community health workers at the health department, and they might refer people to us. So we work closely with them. It's just we have a little bit more of a strict criteria for our enrollment and have, I'd say, a little bit more of a complex care focus.
Okay. And how are people referred to the community health workers? Are they, obviously they don't appear to you and say, I want a community health worker to work with. How do they get connected?
Through our partner organizations or through the Washtenaw Plan. If someone walks into our office and needs help with health insurance, we'll help them with health insurance. But if we say, oh, okay, it looks like you could use a little bit more of somebody to walk you through this, to accompany you to appointments, to conduct home visits with you, to make sure you stabilize, we might refer them to a community health worker. And we're part of a network of 12 organizations, you know, Michigan Medicine Complex Care Team, Trinity Complex Care, Packard Health, Avalon Housing, a couple others. And they'll make referrals to our community health workers to help with these kinds of things.
I commend you for the work with the community health workers. I think the idea of having people work in the community and be able to take a wider, more holistic look at the social determinants of health that people are dealing with is a really great resource, helps to reduce the 5% that Commissioner Robbie was addressing, I think, at the end of the day. So thank you for doing that work, and I appreciate the presentation today.
Thanks so much.
Anybody else that hasn't spoken yet want to say anything before I go back? Commissioner Scott.
Thank you, Chair. Thank you so much. Like Commissioner Hodge, I enjoyed it just as much the second time through. And I am hopeful to work with you on how we can consider more people and more organizations to help fund the work that you're doing. I think that ultimately I find the work that you're doing is at the essence of public health and trying to get people preventative care and healthy lifestyles that keep them out of landing where I work in the ICU, which costs thousands and thousands and thousands of dollars, not only to our health system, but our country. I would hope that people like the university who made 4.2% operating margin on revenues of 5.5 billion can recognize that spending a little bit more for your plan ends up being a much bigger bang for their buck and helps not only on that kind of selfish end of the bottom line budget for them, but also speaks to the mission that we all have of people going into healthcare and taking care of people in our community. So hopefully they will realize that, and we will be able to talk to those that we know in different positions and convince them of that, because I think you're doing fantastic work that's really at the core of taking care of our community. Thank you.
Commissioner Beaman, did you have your hand up? Okay, Commissioner Beaman, and then
Thank you, Chair. And I'm going to apologize for the sunglasses. This is because of our healthcare that we receive. So I have an injury. But one question that I did have that just popped into my head is Commissioner Scott was speaking to the health systems is I don't believe they have a footprint in Washtenaw yet, but my district borders right on Lenawee County. And we have a new ProMedica facility there. So I don't know if there's any type of synergy that could happen in that space as well. I mean, they are coming up from the south. So maybe possible partnerships. So it's just a thought slash question I had.
Great, thanks so much. And, I've read about ProMedica and they obviously have a great emphasis on helping with food insecurity, and I would love to talk to them.
all right, Commissioner Rabi.
Thank you, Chair. Since I'm one that's known to talk, I didn't want to go on for too long without others having an opportunity, but I do have a few other things I wanted to say and ask. I guess I just wanted to say briefly, this is an issue that I've been extremely passionate about. I introduced a bill for single-payer healthcare in Lansing while I was in office. Everybody, healthcare is a human right. I mean, and I've seen too often what you're describing, of people foregoing healthcare, whether it's health insurance or whether even people that are insured foregoing healthcare because they can't afford it. The fact that our healthcare system in America is for profit is criminal. It takes advantage of people at their, lowest moments. And if it weren't for the excellent people that work in our healthcare settings, I don't know what our system would even be. But the whole idea of healthcare companies, health insurance companies, extracting profits on basically not providing care to people is completely heartless. And so in the context of all that, what you're doing in trying to make sure that people even have something that covers them is extremely important and uplifts people that medical debt and being faced with these types of decisions is something that nobody should be faced with. Keeping the lights on or going to see the doctor, it's not a decision that anybody should have to face. The services that you provide in terms of beyond just making sure that people have care, though, I think is critical. And I appreciate that you mentioned the piece about the food assistance declining as a result of changes. And, I'm going to say this just because I can't help myself, but the state and the county, but the state in particular, has a role to play and can and should play a role in avoiding situations like that, declining food assistance in the state. And it is somewhat disappointing to see that money is being spent to give to corporations right now, and has been, even when I was in office, billions of dollars of taxpayer money going to corporate coffers when that money really should be spent on things like this, making sure people have health care, making sure people have food. And I just want to make sure to say that out loud. I'll probably get in trouble for it, but that's okay. I'm in the business of getting in trouble. And I needed to say that. So the question, though, that I have, I knew there's a question in here somewhere. The question that I have is, when you're providing health plan, healthcare to people, what kind of healthcare is it? What are the copays like? Because that devil's always in the details, right? Somebody can have health insurance, but how much do you actually cover for people that get on the health plan?
Right, so for the Washtenaw Health Plan, not people on Medicaid or Marketplace
Right.
coverage.
Yeah.
It is, you can get primary care in Washtenaw County. You can get specialty care here, emergency room care, inpatient care. There's not going to be copays there. For medication.
Is there like a network, like in-network?
Yes, there's a network, U of M, Trinity, IHA, Packard Health, those are our main providers, but Corner Health as well. And, a lot of the specialty providers who are affiliated with Trinity Health as well are a part of that network. And so, I'm proud to say that most healthcare services that, you could get on Medicaid, you can also get on the Washtenaw Health Plan. Not all of them, for sure. We're working on improving our system of care right now. We're hoping to expand to have physical therapy covered, which hasn't been in the past. That's just one example. We're also working on getting long-acting reversible contraceptives covered. We do cover other types of birth control. So working to expand it. Medications are covered at most pharmacies, any of the big chains you can think of, and it's either a $5 or $7 copay. So it's a pretty good system of care in Washtenaw County. If you leave Washtenaw County, it's not going to follow you.
Understood. Yeah. So are there any major services that are not covered?
If it's medically necessary, we can get most things covered.
Okay. Under the health plan
Yeah.
coverage. That's very helpful. Thank you. And so as I was asking earlier, there's no wait list. You indicated that there's no wait list. How is that possible? Like, how can we do that financially, I guess? How do you make that work?
Yeah, so I mean, when you were less familiar with the health plan, we had over 10,000 members. And we moved 7,500 or so to Medicaid when Medicaid expanded. And so that was one of the ways in which we were able to make it work, is because we moved so many different people to Medicaid.
So would you say that you have the capacity to cover 10,000 people at this point, or what do you have
Well,
the capacity?
Financially, no, because we do pay for per member per month fees for our members. And so we can't just expand endlessly financially. But, from my perspective, the more people we have enrolled in the health plan, the better it is for everybody in the county. So we should
Yeah.
find the money to make it happen.
Okay, yeah, that makes sense, but yeah, and so there's no premiums or anything like that, it's just free health, yeah,
You got to qualify. Yeah, for sure.
right, if you qualify free, but so, and would you say that the 5% of people that's remaining do they qualify for the health plan? Do you know?
I don't know, that's the hard
Based
thing
on-
about them,
okay,
but my
yeah.
guess is more will qualify for Medicaid than the health plan, because they are citizens here who might be low income. And so we would try to get them on Medicaid first.
Gotcha. Okay. Well, I look forward to if there ever is a day when you're in need of more help to make sure that we can cover more people. I think that's absolutely something that I would be supportive of. I mean, it's great to hear that there isn't a wait list. I remember that being an issue for a long time. And so I'm glad that we're at a place where you don't have that, but
Yeah, and enrollment has expanded since the pandemic. When I came in 2019, it was about 1,750. Now we're up to 2,500 or so. And so I think this has brought more consciousness of healthcare coverage, as well as more immigrants coming into our county who primarily are the folks we enroll in the health plan.
thank you.
All right, so we've got to move on, but I just wanted to add, thank you for the presentation. Really great to hear the work that you're doing. Two things. 10 years ago, when I moved to Washtenaw County, I was an uninsured 22-year-old. The only reason why I became knowledgeable of My Healthy Michigan expansion that allowed me as a 22-year-old at the time to get health insurance was because I knew the person working at the counter at Planned Parenthood. So I bring that up because I think conversations with people that are normally not aware of things like this are really important. Second point, when you put the map up, the brightest spot or the darkest red and the dark orange spots were the district that I serve. And I feel like I have a really important role to play here in talking to people one-on-one, and I invite my colleagues to join me. And I would love to work with you to get that information out, especially to help make sure people don't lose coverage. So just thank you for your work. I get that you don't really have the capacity to do some of that door-to-door coverage that might be necessary to help people. But I'm willing to, and I would love to partner with you to, get the appropriate information and resources, I guess, in my hands so I can help get it to doorsteps. So thank you so much for your work.
Great, thanks so much. Looking forward to that.
All right, moving on. We have a presentation on the Food Policy Council Annual Report from Jay Gerhardt.
And I failed to send you the PDF of our actual annual report before this. So Andrew's going to help me pass it out when he gets a chance. Ooh, I just tried. Awesome. All right, so hello, everyone. My name is Jay Gerhart. I am the chair of the Washtenaw County Food Policy Council. This is our annual report. We do this once a year for the commissioners. We usually do this in November or December of the year that we're presenting about. However, due to a number of factors that got pushed back, so here we are in March, talking to you about 2022 and looking ahead to 2023. I'd like to recognize that my fellow council members, some of them are also here with me today. I might bring them up for Q&A if there's questions you have that they're more of the expert in. So what is the Washtenaw Food Policy Council? We are a subcommittee of you guys. Our mission is to increase and preserve access to safe, local, and healthy food for all residents of Washtenaw County. A little bit about our history. We started in 2012 as a committee of the Food System Economic Partnership. That was a group of food stakeholders in our county working on building a more robust local food system. The members at that time recognized that, hey, this actually could be really effective as a body of county government. The health department at that time was able to secure funding for us to form as a food policy council. And in 2012, the BOC approved us as a subcommittee. Since then, we have pursued other grants to help us strengthen our internal processes, work on our policy agenda, and collaborate with other food system organizations throughout the county to steward policy changes. Our values, what we hold dear. We value the entire food system, its complexities and multiple facets. We value our commitment to social justice. We have a racial equity statement. It's on our website. We value evidence-based decision-making. We value the stewardship of human, financial, and environmental resources. And we value collaboration rooted in trust and compassion. So the structure, what we are, how we kind of work. So the council itself is 18 members that are appointed by the Board of Commissioners via our recommendations. 5 of those members sit on the executive committee. There's a chair, a vice chair, a secretary, a racial equity liaison, and a policy liaison. And then the rest of the members are required to serve in one of our policy action teams. You'll see there's 5 policy action teams with different topics: food access and nutrition, farmers and institutional purchasing, planning and zoning, food waste and packaging, and pollinators. And these policy action teams is the way that the public most directly engages with our work. It is kind of the boots on the ground where all of the action happens in terms of food policy in our county. So as I said, we're 18 members. It's really important to us and to the work of building a robust food system that these members come from different sectors of the food landscape. So we have all these sectors here. I'm not going to list them off, but one that we added last year was our disability justice seat, and we also filled it. So how we work, we have 6 meetings a year, every other year for 2 hours. That's our full council meeting. And then those policy action teams typically meet monthly for about 2 hours. And the health department is our fiduciary. And so funds, thanks to you guys, are allocated for us for 0.2 FTE to help us with some of that admin, for stipends for our council members for those full council meetings, and then a little bit of the admin to then process all of that payment. We have created a policy agenda. It's kind of the first thing that the council does, and it's been updated a couple times since. The policy agenda is the backbone of what we do. It helps guide the work that we're engaging in. For those PATs, for those policy action teams, any initiative that they take, we need to be able to tie back to those policy agenda items to kind of keep us on track and make sure that we're doing the work that we set out to do. So now I'm going to talk about 2022 and kind of what we did. And you'll see I have like little blurbs there. A lot of what guides our work right now is a 5-year strategic plan that we made back in 2017. And so one of those strategic plan ideas was that we become engaged with state legislators to help provide insights on bills that impact Washtenaw County residents. On May 10th of last year, the Michigan Local Food Council Network, which is a peer-to-peer learning network throughout the state, hosted a legislative education day in Lansing, and 3 of our members attended. These folks kind of learned how Michigan legislature functions. They did some skill building on building relationships with their legislators, and they met with Senator Irwin and Representative Brabick. Thank you. I always write her name, but I don't say her name. On issues involving food waste and packaging. We have a big topic this year, which I'll talk more about. So another one of our initiatives is that to keep learning. Our council turns over pretty dramatically every year. We're like mostly volunteer. I know we get the stipend, but things happen in life and people come and people go. And so we really try to make sure that, especially the new folks, but our veterans as well, are really always learning about issues relating to food policy. So luckily, our Michigan Local Food Council Network in the state hosts learning opportunities, and we highly encourage our members to attend. The 2 that they hosted this year was policy advocacy campaign organizing, which I know you all love campaign organizing. And then diversity, equity, and inclusion, equitable participation. Our very own Keisa Johnson, who's in the room tonight, helped lead that DEI piece. And that group really convened around evaluating the tools necessary to expand connections and doing that in an equitable way. So one of our biggest and kind of most salient initiatives that we've been working on for a couple of years is to set ourselves up as a group that regularly advises local leaders, county commissioners, board of health, city council members on any issues affecting our food system. We want to be your experts, the people that you can turn to and you're like, hey, does food's in this one, food policy council, like, what do you think? And some of you have come to us in the past and we really appreciate that. But we know that that's a two-way street. We need to be here at your meetings, keeping track of what you're saying. We need to be out in the community with some of those organizations that focus on issues that potentially intersect with food. So natural resources, community health and well-being, and economic development are just a couple. So in order to better do that, we set up this last year liaison assignments for our members. These are either nonprofits or county governments that we're maybe already participating in, and we can just take off our hat and change hats on at the meeting and just keep an eye on any issues that could relate to policy or that the Food Policy Council could help bolster. Not pictured here. It was really easy to get icons for nonprofits. It's a lot harder to get icons for like Sharon Township and Northfield Township. So they are also in that list of people that we are regularly watching meetings, attending meetings, reading meeting minutes. Board of Health, IPSI Sustainability Commission, the Waste Implementation Plan Advisory Committee, LPAC, and then a lot of the townships that some of us are already engaged with or live in. And the last big initiative is on development, making sure that the council is one that can respond rapidly to funding opportunities. We don't raise our own funds. We're a subcommittee of you guys, but we do use grants to support projects as kind of like a pass through. We applied for and got an intern this summer through the Development Summer Internship Program at U of M. That's Mariah. She was a hoot. This was a collaboration with food gatherers. So she was kind of between both of our organizations. And she really helped us think about and expand our social media presence. while we're not raising money on social media, it's important for us to be, to have a strong social media presence so that when we do want to educate or we do want to advocate, we have a ready audience. Okay, so those are our big initiatives. And then we have our PATs. I'm just going to talk about two today, the two that kind of did the most work, I would say, in the last year. So our food access and nutrition PAT, that has always been a very popular PAT. Lots of people from the community are engaged with that. What came out of that PAT this year was a food sovereign Washtenaw work group. So this was like people who are really interested in what does it mean to have a food sovereign county. They explored, this is a work group, so they're kind of like a study group. They were exploring elements of food sovereignty. They were looking at food access data, which is the picture I have up there. They were looking at right to food campaigns and just gathering information. What they're now pivoting to is really putting that into action. They've identified a thing that they want to kind of work on, which is helping landless residents access community garden spaces, places to grow food, even if you don't live on land. And then our second PAT, the food waste and packaging work group, that had a bunch of new energy this year. And they started by just saying, what's going on in the community? What's already happening? How can food policy help bolster the work that's already going on? They attended the Washtenaw County PIAC committee meetings. And we did find an opportunity to help. We are applying for a $5,000 grant from an organization that gives grants to Midwest Food Policy Councils. $5,000 is very small, but it's going to help. The application is to help build a vermicompost center at the Stabler farm to help educate folks about vermicomposting, reducing the waste, like food and organic waste from your from the regular municipal waste into into a better place. And this all ties back to the Resilient Washtenaw Climate Action Plan, which you guys passed. Thank you. About developing countywide organic composting program and building a multi-dimensional public education promotion plan for a circular economy. So that was 2022. Looking forward to 2023. Keep saying we got grants, but we did get a grant, another grant, to help us redo our 5-year plan, strategic plan. The $5,000 will go towards a consultant to help us go through a participatory process for recreating a strategic plan that will help guide our work in the next 5 years. We also finally transitioned from a WordPress site to the actual county platform. So we are official in the eyes of the public. And you all, I'm sure, are aware of this, but the Farm Bill is being, oh my gosh, what's the word? Not reappropriated. Thank you, reauthorized in 2023. Oops, not what I wanted to do. And so the Food Policy Council, in collaboration with our local organizations, was really focused on community education when it comes to the food bill or to the Farm Bill. So having talks, having meetings, getting the word out there. What is the Farm Bill? Why does it matter? Why should I care? You are likely going to get across your desk opportunities to sign letters for things like, reauthorize this part and give more funding to this part. And so we invite you to look closely at them. If you have questions, please reach out to us. If it's something you want to support, please sign on. I think every little bit counts when it comes to that massive piece of legislation. And lastly, it came up recently in a meeting, questions about the county master plan and any plans for updating that in the near future. And if so, the Food Policy Council would love to be involved and to add more food parts into that master plan. So thank you for your support. I want to call out specifically, thank you for support in the, I can never say this, quadrennial budget. That includes support for those food agencies that are working in the human health sector. That's really important that they're big partners with us. It's really important the work that they do, as you guys I'm sure know. So thank you. And we also applaud the new advisory council on reparations, and we're curious to see where that goes. We want to be involved. So, all right. That's my song and dance.
I'm going to start with Commissioner Hodge, then Commissioner Robbie, and then Commissioner Machewski.
All right, thank you, Madam Chair. Thank you, Jay. Thank you also for being willing to be rescheduled. I know, and it should have been into last year, but the end of last year got pretty wild. And thank you to the rest of the team that came to join for the presentation too. And this is one of the issues I'm most passionate about, and I wish I could have assigned myself to it. But, you know, in doing committee assignments, you try to make as many people happy as you can. And I know my friend Commissioner Sanders really wanted to stay on. But I still want to be as helpful as I can. So I have some questions that can hopefully help me be more helpful. So looking at the policy agenda slide, it looks like it was last updated in November 2021. And I see that there are still some on here for the county. And that tells me that we need to be doing something there. So could you talk a little bit about what you would like to see us do from a policy perspective?
Oh, that's a great question. And I don't remember which exactly of those parts it relates to the county, particularly. Does anyone have a policy agenda on them? No.
It's on the slide.
on the
Yeah, I
slide,
just wanted you
but
to talk a little bit more about, Andrew, can you go to the appropriate slide?
Might be able to see it. I don't know.
Might be a little hard to see. And if you can't answer it, that's fine, because I have other questions I can ask. I know Commissioner Robbie does too.
Okay.
Wait. Right, yeah.
Yeah, that's so tiny.
Well, the resolution might be poor, even if you zoom in. That's okay. We could talk about that. We can talk about that another time. I just see that we have more work to do that we could be doing here. If there are ones on here, because there are some that are specific to the county. There are some that are combination county and municipal.
Yep.
And so that's something that we should talk about and figure out what we can do to be helpful there. Now you can see it, hopefully. I don't know if you want to say anything about them or.
Yeah, and you know, as you're saying that, the thought that comes to my mind is like, there's a bunch that relate to the county, because we are a body of the county government. And we're not always working on all of them at the same time. And so it really comes down to like the momentum of who's in the room and who's willing to kind of do that extra work. And what I think what might be the gap is knowing who and where to reach out to for some assistance. And know, like, being okay with almost like also not knowing exactly what kind of help we need and saying, this is what we want to do. Is there anything you can do to support us or build our capacity? We also know you guys are busy, so I think that's why we often like step back a little, but that's a really good reminder, that reaching out about the things that we're working on a more regular basis than just at the annual report every year.
Yeah, my hope would be that for the ones that are county specific, that we could check them off and then they wouldn't have to be on the list anymore, because at least we can affect county policy. We may not be able to, you know,
Right.
it's state policy, but we can do the county piece here. So that's something I think we can figure out. And the point you had about figuring out how to advise us better, do you have specific things in mind other than doing your once a year presentation, which is great, but we could be, you know, is there something else to be more helpful?
Yeah, well, you know, so the thing we can do is be more active in your meetings, which we have improved this year, and keep an ear for anything that food can help with. And also for you guys to know where food could be a solution. So, or food is an important part of the solution. So, there's a great example of something like this. There was a park, and I'll try not to get too off track, but there was a park. It was very dangerous. This wasn't in our county. This was somewhere else. And they were staffing it with police, but like it wasn't changing how dangerous this park was. They put in a community garden and now there's a ton more people there. They're on a more regular basis. They're there with their families. There's more eyes and that park improved, right? Like the crime decreased. And so things like that, like these creative solutions to like some of our problems, we don't always see it right away. And so thinking about food as food, gardening, you know, can be an ally in some of those
Yeah.
things.
So you might not have an answer to this right now, and that's fine. But I just want us to think about what can we do to be more supportive of your work. You mentioned the pretty regular turnover, because I know because of the amount of work and then the very little compensation. I know that's a component. Are there other things that we could do to be more helpful and maybe addressing the turnover or being more supportive of the council in other ways?
Yeah. So we advocated for, and it was very easy to get that $25 per meeting. And we did that because we were in our heads thinking, oh man, the people who can really participate at this point are those who have the time and the resources to be able to participate. And maybe extra money would help. And then we got the stipend, but it's not enough to like change that dynamic. So in terms of helping with the turnover, it's a good question. I don't think throwing more money at it is the solution. And also like, you know, there are lots of things to support in your budget. Does anyone from the council have an idea? Yeah. You wanna come up?
You gotta come to the mic,
Yeah.
otherwise it's gonna be picked up
This is Kisa.
live. Yeah.
Gotta keep the mask up.
Hello, everyone. I'm Kisa Lee Johnson. I'm the racial equity liaison. But when it comes to policy, like we're here to be like, have a reciprocal relationship with you. And a lot of things that what we've been noticing is the level of the compensation and us being more equitable when we're reaching out to farmers and food workers who are at the center. They're the ones who work in the sun for us to work in the shade. Like the stuff that we're doing, they're in the center and the forefront of everything. And the way that our council is structured and how the payments are, is sometimes is a barrier. It's not very equitable, you know, and we're together trying to figure that out. And to me, some support that we can do, we did start an initiative of trying to figure out how to pay like a food coordinator, like a food manager, that will kind of help be that bridge between us and the county when it comes to funding. So we're able to fund these community projects right on the ground and get the things that's needed, because we are like, we're pretty much in the nebulous of, we're here for municipal work, but we're also community members and we're on the ground as well. And so we're in that nebulous space where we really want to be supportive of the work that you do, because you're here to help champion all of that. And we just want to be good champions and work exactly with you. So funding is an issue for us. So.
Thank you.
All right.
I know we're almost out of time, so I'm gonna stop, but love to have a follow-up conversation. Thanks. Thank you, Madam Chair.
Thank you. The next person that had their hand raised was Commissioner Bobby.
Thank you, Chair. Yes, thank you for your presentation, Jay. And I do remember 10 years ago, writing the resolution for the Food Policy Council with Sharon Sheldon
Yeah.
and a few other activists that were, working on putting this together. So I'm glad to hear that 10 years later, everything seems to be going well and well guided under your leadership. So we appreciate you. And that's mostly what I wanted to say, but I did want to piggyback off of what the chairman was saying earlier. Because I was on the Food Policy Council for about 4.5 years since I was the initial Board of Commissioners liaison since I helped to create it. And then, when I left, obviously I wasn't on it anymore, but we created that policy agenda. And obviously you said it's changed over the years. And in the initial years, we were in formation, we were building, we were creating capacity. And one thing that I think would be helpful now, building off of what the chair was saying, is of all the recommendations, it may be helpful to pick the top one that is actionable for us to complete to check that box and maybe come at us one at a time because we are busy. There is a lot going on, different things happening, but to the chair's point, I do like the idea of starting to check some of those off the list because looking at that, some of those have been on there for 10 years. And some of them, frankly, you can't really check off the list. There are things that we have to do over time. But like the purchasing policy is one that I noted on there. And we did do some work on the purchasing policy 10 years ago. And I know that some work was done in the intervening years as well. But on the issue of food, that could be an area that we could take action on in the short term. So point being, might be helpful to come back to us with a recommendation on one or two pieces that you want to prioritize, obviously after discussing with the rest of the council.
And I will say that there are, in those re-edits, there were a couple things that got taken off because we had accomplished them. But that's a great recommendation of just biting off little bits.
I would love to, next time you come with that recommendation, would be helpful to see what you were able to check off the
Cool.
list.
Okay.
Commissioner Beaman, and then did I see another hand? No, and then Machi, okay. Okay, yeah, you were on my list. I'm sorry. Commissioner Machewski, then Commissioner Beaman.
Thank you. I'll try and be succinct here, Madam Chair. Jay, thank you for you and your colleagues being here tonight. I want to raise an issue that I think is related to points 12 and 15 on your policy agenda. In February, there was a meeting of meat producers
Yep.
here in the county. Over 100 people attended that meeting. And it was small farmers who like to focus on the farm to table aspect of agriculture. And the focus of their meeting was consolidation in meat processing and the fact that over recent decades, it's become a really corporate endeavor and they don't have a place in Southeast Michigan to send their product for processing. And talked about that quite extensively at that town hall meeting. They are limited in terms of access to processing and they have to travel long distances. There's no organic processing, and pointed out things like when we go to the grocery store here in Washtenaw County and something is labeled as local meat, it might not really be local.
Right.
And so is there anything in your policy agenda or anything that you've done at the policy council to address this issue? I don't have an answer to it for you, but
no.
would be curious to know if you've taken any positions on the meat processing issue.
We have, and actually, I'm so glad you asked about this because it's near and dear to my heart. And last year, the Food Policy Council realized that one of the gaps we have many assets that are going to help fix this problem. We have someone who's willing to be the entrepreneur to build the dang processing facility. We have farmers that are ready to go. They have the animals. They've been engaged. We have the market of people willing to buy this meat at a higher price than in Meijer or Kroger. And one of the things we were missing is for this entrepreneur to get the land to be able to build the facility. So that's where the gap was. And so we as a council, we created a fact sheet for our township supervisors and township communities. We went to their meetings and we said, this is what a processing facility looks like. Because when you hear processing facility, you're like, ooh, dirty, smelly, loud animals, blood. Like, no, I don't want that in my community. And so we said, no, this is actually what these small processing facilities look like. Here's their size. This is what happens with the water. This is how much noise is made. And getting ahead of that before the entrepreneur comes and says, hey, I want to build a processing facility, educating the township before that, we found to be really critical. And so we did that with a lot of the rural communities that Commissioner Beaman is a part of. So Freedom Township, I'm not gonna be able to list them all out. But that was the little niche that we said, hey, we can help with this piece. And we have the expertise to be able to do it. So it's an ongoing issue. We are definitely engaged and we're like ready to think about what's next as far as what we can do to help.
But it's good to hear that you're involved and engaged on that, and I appreciate that very much. Thank you.
Yeah, thanks.
Okay, Commissioner Beaman.
Thank you, Chair. And thank you for your work and your presentation, and thank you from my farmers. And again, I apologize for the shades. Mine is more kind of like a call to action for my fellow commissioners, which is that you brought up the Farm Bill, and that's the largest piece of legislation. This is Stabenow's last Farm Bill. And within the Farm Bill, it has everything from obviously supporting food, but other things that you're involved in as well. So looking at rural access to healthcare, rural infrastructure, research for universities, we don't have any of those that impact food and food policy. So it really runs the gamut, including conservation and looking at weather crisis and all of the things that have been happening to us. So this is kind of a charge for my fellow commissioners to get involved in the Farm Bill, even if you think it doesn't impact your community, because it's going to impact your community in many, many ways. So thank you for the work that you do. Thank you.
Absolutely.
All right, thank you so much. Do I have any other comments at this time? All right, thank you so much. Yeah, I love to be supportive in the process as well. So I'm on board, Commissioner Beaman. All right, moving on to items for current and future discussion. Nothing? Okay. I will entertain a motion to adjourn.
So moved.
A second. All those in favor? All right.
on via your computer or phone through the app, you'll just click the raise hand icon. I'll call on you and then you will talk and you'll be unmuted. Anybody like to give public participation? No? Nobody in, and no one in the room? Anybody online, Andrew?
Yes, Chair, Harvey Summers would like to give public comment.
All right, Harvey, please state your name and where you are calling in from.
Harvey Summers, Scioto Township. I want to thank the board for its work on the new bylaws for the Criminal Justice Coordination Coalition 2 weeks ago, but I don't see anything in terms of an update to the website about meetings and the meeting schedule for this year. So I'm hoping to see that in the near future. I also want to mention that I'm about to go to another Friends of Restorative Justice meeting in the near future, and I'd be very much interested in any updates possible on the county working on finding space for a restorative justice center. Thank you very much.
Thank you, Harvey. And I know you are a frequent visitor of our meetings, but I still need you to state your name and where you live.
Harvey Summers in Scioto Township.
Thank you. No one else for public participation. Okay. All right, well, then we will move, last call for the room. Very unusual. That's right. Okay, we're gonna move on to commissioner follow-up to public participation. This is the point where commissioners may respond. Anybody like to respond? Nope, I will respond. Thank you, Harvey, for your continued interest in the CJCC. We are going through the process of posting the additional community member spots, and those spots will be appointed after the application window ends. And then from there, we will get a meeting scheduled. My expectation is the meeting will be scheduled for the second quarter of the year very soon. And I am confident that you will be one of the first people to know about it. I'll make sure of it myself. And for the question about the Restorative Justice Center, we'll need to continue to do a little bit more work on that, and I'll get back with you on that when we have more information. Thank you. Okay, we are going to move forward into liaison reports unless Crystal here, unless I think we have an item that was, yeah, are there family members here for a special item? Yes, there are. Okay, so I'm going to move us forward. As entertaining as our meetings are, and there's a lot of great government work that happens here. Not everybody wants to stick around here on their Wednesday night. So sometimes there are certain resolutions that we like to take out of order to honor members of our community, and we are going to do that right now. I'm going to move forward with on a resolution to honor former County Commissioner Albert A. Robinson, and I believe his family is here. Thank you for being here. I'm going to read the resolution and then you'll have time to say whatever you would like to say, if anything at all. Thank you. Yep. All right, so I'm going to read this resolution. It's the resolution in honor of the Honorable Albert A. Robinson, former member of the Board of Commissioners. Whereas Albert A. Robinson was born on May 2nd, 1937 in Lawrenceville, Virginia, and whereas Mr. Robinson attended Virginia State University and Central State University, joining the illustrious Phi Beta Sigma fraternity. And whereas Mr. Robinson served in the United States Army, retiring after 20 years with the rank of Lieutenant Colonel. And whereas Mr. Robinson moved to Ypsilanti, working first at Ford Motor Company and then Eastern Michigan University. And whereas Mr. Robinson was dedicated to serving the people of Ypsilanti, he was co-owner of a small business establishment, Ypsilanti Seafood, served as chairman of the trustees for Second Baptist Church of Ypsilanti, served for 12 years on the Ypsilanti City Council, chaired the EMU Black Faculty and Staff Association, and served on the Ypsilanti Housing Commission. And whereas Albert A. Robinson generously devoted his time, energy, and expertise to Washtenaw County, Michigan, made numerous contributions by serving as County Commissioner for then District 13, Vice Chair of the Ways and Means Committee, Vice Chair of the Board, and Chair of the Board Working Session. And whereas during this time, Al served on the Area Agency on Aging 1B, Brownfield Redevelopment Authority, Foster Grandparent Advisory Board, Community Action Board, Workforce Development Board, Sheriff's Community Relations Advisory Board Ad Hoc Committee, the Head Start Policy Council, and the chairman of the Washtenaw County Private Industry Council, and was faithful in his duties And whereas Al provided his leadership, abilities, and expertise advocating for the citizens in the eastern part of Washtenaw County community and created a legacy of public service for others to follow. Now therefore be resolved, the Board of Commissioners offers its most sincere condolences to the family of Mr. Albert A. Robertson, and be it further resolved that the Washtenaw County Board of Commissioners hereby extends its appreciation to the legacy of Albert A. Robinson for his commitment to community and dedicated service to the citizens of Washtenaw County.
I'd like to thank everyone for honoring my father, my mother's husband. As you can see, my dad did a lot. And I know, watching him be involved in the community, the sacrifices you guys are making here to move Washtenaw County forward. So I would like to thank you for what you're doing for this community and continuing, that will help continue his legacy on, because without people stepping up to the plate, we will not be able to have the community that we all deserve. So thank you again for your service. And thank you for the acknowledgement.
And mine's gonna be very short. Just would like to thank you for thinking about Al. Al was very busy, but he was also a God man and a family man. God bless you and keep up the good work. Thank you.
Cool.
Thank you.
Let's get that nail back in there. Either one without me. Go ahead, take a picture and then we'll get that nail hammered in there.
Yeah, I just wanted to say hello. I worked with him before he did. Okay. It's time for me. Yeah. Nice to meet you. Oh, right. Thank you. Thank you. Great. I'm Lisa Robinson. Thank you.
You're welcome to stay for the rest of the meeting if you'd like.
Okay, I'd say, yeah, I'll give you that. Maybe a wink.
So before you head out, I do want to say that, as you mentioned, this kind of public service is very challenging and it takes dedicated loved ones to support everybody that's in the space. So thank you for everything that you've done. You too. All right, back to our agenda, back to our regularly scheduled programming, which includes liaison reports. I think I saw a hand from Commissioner Machieski. Click on the draw.
All right, thank you, Mr. Chair. I want to first note that SEMCOG's General Assembly is coming up on March 23rd at Marygrove Conservancy in Detroit, for anybody that's interested. But wanted to bring forward information from the Board of Public Works meeting that was held this morning, and to remind everyone about the household toxic waste drop-off site at the county building on Z Road. You can drive up if it's not a really large or huge amount of stuff that anyone has to drop off. They can do that Tuesday through Friday from 9:30 a.m. to 4:15 p.m. It's kind of a show up, and county staff will come out and assist you with dropping off those materials. There's also drop-offs on 20 different Saturdays throughout the year. Those are select Saturdays, so it's not a consistent particular Saturday of the month, and it's best if people would check the Water Resource Commissioner's website for those dates. But also wanted to note the cleanup days. I think many people participate in those cleanup days that are held around the county. There's going to be some changes to the cleanup days this year in order to focus a little bit more on the traffic situation that occurs at those cleanup days. If you've ever been to one, I know the one that's held out in Linden Township, there's a line of cars all the way down Workner Road. They're going to be moving to an appointment process for cleanup days this year. So approximately 6 weeks out from a cleanup day, there'll be an opportunity for people to go online and sign up for a particular time to show up at the cleanup day. This is also a way for to make sure that it's county residents that are coming to these events. People will be required to put their addresses in, and those addresses will be checked beforehand. People will have to, and they'll get an email back, and people will have to use their phone and basically show the confirmation. And the signups will close 1 week ahead of time. I want to note the first cleanup event is going to be on June 28th, held at Whitmore Lake High School. And come June of this year, there's going to be a new drop-off site for household toxics at the landfill out in the northeastern part of the county, with more information to come about days of the weeks and times for that drop-off site as well. Thank you, Mr. Chair.
Thank you. That was a very thorough liaison report. Any other ones? Commissioner Somerville.
Thank you, Chair. I had 2 Fridays ago, a Commission on Aging meeting, and my updates are just, I know that we don't really have updates yet, but just to share, we're still hoping to get some information on the money that was appropriated for senior support. So hopefully we'll get an update soon-ish. And then also, I know that we had like tentatively, well, we saw the map that like showed county buildings, but it wasn't specific to senior services, or I guess what we're putting into senior services. So I just wanted to lift that up to find out when we could tentatively get like some sort of document that could help, especially as people are engaging with, I know at least I'm getting questions about the potential senior millage and folks wanting to know like what we're already spending on senior services. So just wanted to lift that up as we continue to move through this year. Thank you.
It's been lifted up. Commissioner Labar.
Thanks, Chair. We had one of our bi-monthly continuum of care meetings today. A lot of detail, a lot of substance. The big thing I'd flag for this board is the active sheltering season for overnight is coming to an end at the end of this month, and the intake period to start that process is coming up within roughly a week to 10 days. So wanted to just flag that, and staff are the right folks to follow up in terms of more detail on that. So thank you.
Thank you. Anybody else? Commissioner Light.
So I attended the Michigan Work Southeast Consortium and Michigan Work Southeast Workforce Development meeting on the March 8th. And a resolution was passed for the Workforce Innovation and Opportunity Act statewide activities and funding of the amount of $187,500, which will support our Michigan Work Southeast workforce development greatly. And then there was also updates on the move of Michigan Works leaving from Harriet and Ypsilanti to the new location. So they are continuing to work on that and progress. And so hopefully in June or July, they will be placed in their new location to service us. And then I also paid a visit to the Friends of Rouge on Wednesday. Oh no, today is Wednesday, on Monday. And received some really great information about our rivers and about our lakes and just how we need to make sure that we are very conscious of what's going on. So more updates to come as we continue to partner with them. That's all I have for you.
Very nice. Thank you. Commissioner Scott.
Thank you, Chair. I have the pleasure of being at the Washtenaw County Parks and Recreation Commission meeting this week. It's always a pleasure to be there. We heard about some ongoing events. In February this year, we had 9 couples come to the Stargazing with Your Sweetheart event. Last year, apparently, somebody was proposed marriage to at this event. Didn't happen this year, but maybe it will happen next year. It sounds super romantic to me. We had 18 families attend the Lantern Lit trail hike through the marsh and along the lake on February 24th. We also talked about the Mary Lou Recreation Center, about increasing some visibility, how they will do more community outreach. The hope that we will increase learn to swim classes, maybe through Mary Lou. We talked about the Hunt for the Yeti at Rolling Hills. More than 180 participants came to explore the park to look for Yetis. There was a disc golf tournament on February 12th with 72 participants. And we are continuing work forward on Stabler Farm. Border to Border Trail construction will continue when the weather gets better. We are looking at more areas for the Natural Areas Preservation Program. Hopefully to extend some areas up in Whitmore Lake, and looking at more volunteer programming and camps for kids in different parts of Ipsy. Always so much fun stuff to talk about at Parks and Rec, and also always with an eye to thinking about how we expand those programs out to all areas of our county, including continued discussion about East Side Rec Centers. Thanks.
Thank you. I always wonder if the Parks and Rec Commission is as fun as the TV show.
I have never seen the TV show, so now that I'm on the commission, it might be time for me to watch the show. But the Parks and Rec Commission is a lot of fun. I'm glad I'm on the committee. Okay.
Excellent. Any other liaison reports? Is that it? Nope. Seeing none. Thank you. Well, thank you, everybody. I would just add that it's been a pleasure to have Commissioner Scott with me on the retirement board. If for those of you that have never attended and you have hours available on a morning, it is worth the time. It's a very hard-working group. There's a lot of great work going on there. And I think people they can rest assured that the county is managing your retirement accounts very well. It's a good committee. It's a good committee. Very hardworking. Okay, we're gonna move on to the next up. We have no special order of business. We have no appointments today, but we will have several next meetings, so stay tuned. And we're gonna move on to consent agenda. Anybody want to move the consent agenda? All right, all in favor? Aye. All right, excellent. All right, we're gonna move on to resolutions, and we're gonna look for somebody to move the first reading resolution, which there is only one of. Oh, Commissioner Scott.
Thanks, Chair. I'm going to move 9.1A, a resolution to approve all formula grants received by the Office of Community and Economic Development with a fiscal year starting in 2023 calendar year.
Any discussion on this item? Seeing none. All right. This is a voice vote. All in favor? Aye. Any opposed? None. Excellent. Okay, we're gonna move on to the final reading and single reading resolutions and approval of claims. Anybody like to move those? Commissioner Scott?
Thank you, Chair. To a final reading, a resolution approving position modifications in the Office of Community and Economic Development to address the increase in weatherization programming through the Weatherization Assistance Program Bipartisan Infrastructure Law Grant. B is a resolution to update the revenue state liquor tax policy. 3, in the single reading, we have a resolution to borrow against anticipated delinquent 2022 real property taxes from the county treasurer. 3B, a resolution approving the commercial rehabilitation district for 300 North Zeeb in Scioto Township. C, a resolution authorizing the chair of the Board of Commissioners to sign the home ARP grant application and certifications for submissions to the U.S. Department of Housing and Urban Development. D, a resolution to honor former County Commissioner Albert A. Robinson. E, a resolution proclaiming March 2023 as March for Meals Month. 5, a resolution proclaiming March 2023 as Social Work Month. G, a resolution in support of the Michigan Association of Local Public Health's 2023 legislative and funding priorities. And 4A, a resolution authorizing the payment of claims commencing with the last previously approved claim and continuing through the date of March 6th, 2023.
Whew, that's a lot of reading. Thank you, Commissioner Scott.
Thanks.
All right, would anybody like to pull any of these for separate consideration? I expect there will be some. Commissioner Robbie. Okay, Sile. Any others? Commissioner Sanders, was that a hand? Nope, you were just okay, I'm trying to be attentive. Okay, trying to be attentive. Did anybody else want to pull any other ones? I'm gonna ask that we do pull one item because we have our treasurer here. So I'd like to, someone want to pull the treasurer's item? Thank you. We're gonna pull it. Appreciate it. Appreciate that. It's good teamwork. Any other ones? Seeing none. Okay, well, then we can get right to it. So the first one would be B. Said what? The county treasurer. Oh, there it is, single reading, yep. Yeah, we could just go ahead and vote all the other ones. But I like to do the separate ones and we vote them and then we go. It's fine, it's fine, okay. All right, Madam Treasurer, would you like to join us to talk a bit about this one?
Thank you. Thank you very much, honorable commissioners, county administrator, corporation counsel, members of administration, our finance director, and I know our racial equity officer was here earlier. So thank you very much for agreeing to handle this on a single hearing. And I'm assuming that you'll have a roll call vote afterwards. So we'll have a record for the bonding and the note. And I wanted to introduce Eric McLaughlin from Dickinson Wright. He is the bond counsel for our delinquent tax revolving fund in Washtenaw County. So thank you again. I am available to answer any questions you have, being that it is on a single reading. I know many of you around this table have been through this before and have heard all of the speeches. So I don't really plan to make a speech, but I do want for some of the newer commissioners to explain how the General Property Tax Act works. This resolution is in conformity with the General Property Tax Act, and it's a requirement that we are required to pay out in advance to all the local units, the schools, the parks, the libraries, any of the money that they couldn't collect last year. So when your tax bill comes in July, most people get it paid. When the December tax bill comes last year, most people get it paid. But some people are unable to pay or they make partial payments. And any taxes that are still uncollected as of March 1 come over to the county treasurer for collection. And I've got years to collect them, but the local units don't have years to acquire their budget. They had a budget, they have staff, they're providing essential county services, libraries and parks, fire, police protection, your cities, your townships, and also Washtenaw County has a portion of that tax bill. And in order to meet our budget, that money is advanced to everyone. And then they go, the local units go on and handle their services to the public. And as I collect the taxes, that bond issue is paid back. So the notes, I said in the resolution, would not exceed $25 million. I thought it would be approximately 18 million. In fact, we have loaded all of the rolls as of yesterday night. Excuse me. We have approximately 17 million that is delinquent. And we will be borrowing less than that because we're making collections already. The first 2 weeks of the month, as we loaded the rolls, we sent out notices, we started bringing in revenue to the county. And we cannot borrow by law more than what the actual delinquent taxes are. And sometimes we borrow less because we know that we've got a little bit of money already in the delinquent tax revolving fund because it revolves. So we will be borrowing less than 17 million when you approve this resolution tonight. And that will bring fiscal stability to our local units. And I will stop there. I have a couple other reports that I make by law at this time of the year, but I'll just see if there are any questions.
Any questions, anybody? I know this can be fairly complex. Yeah. Seeing none. Okay. Oh, Commissioner Light.
So will this, when the advancement is given and will homeowners with their tax?
Commissioner, I'm having a hard time between our masks.
Okay. Yep. So will homeowners end up, you said some of those will make partial payments or have not paid at all. With us getting the advancement, will that raise the taxes and then homeowners will still be in the same situation and then we will have to borrow again? Or how is this?
We borrow every year.
Mhm.
This borrowing is solely for the 2022 taxes. We have other borrowings. Last year, we borrowed for 2021, the year before for 2020. The big difference in this borrowing is our interest rate has been quite low. 1.5%, 1%. It'll be above 5% this time.
Okay.
We'll do a competitive bid, but it'll be 5% or greater.
Thank you.
Any other questions? Seeing none. Okay, I think we're prepared to vote on it then. This is a roll call vote.
Commissioner Somerville,
We'll circle back to her
I'll
if there's time.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner LeVar,
Yes.
Commissioner Light,
Yes.
Commissioner Machieski,
Yes.
Commissioner Robbie, Commissioner Sanders, Commissioner Scott.
Yes.
Okay, Commissioner, I think Commissioner Somerville is walking into the room. All right.
Commissioner Somerville.
Yes.
All right, excellent. Thank you. Fantastic. Madam Chair, or Madam Treasurer, do you have anything else for us?
Well, thank you. Thank you again very, very much. In terms of cash and investments, I am managing for you a portfolio of approximately $300 million. Our annual report will be coming out shortly, and I will see that each of you get a copy of it. Administration routinely gets monthly copies of the cash and investments report. And the annual one and the semi-annual one, I always publish on the website. So the public has that as well. What I did want to mention is an arcane accounting requirement. It's called GASB, the Government Accounting Board. GASB has a rule that at the end of the year, at the end of your fiscal year, you need to be transparent to the public and say, if I sold this whole portfolio on December 31st, what would it be worth? And it wasn't worth the $300 million because as interest rates went up, the value of our securities went down. So we are down about 2.5%. Most portfolios in the public sector are down closer to 5%. But as I saw interest rates rising, I was shortening our durations or our maturities of the investments. So we weren't hit very hard. And of course, December 31st is over and I didn't sell anything, so we never realized that unrealized loss. But I just want to let you know about that, make sure if there are any questions about how that works, that I'm here in front of you and in front of the public to answer any questions that you might have.
Thank you. Any questions, Commissioner LeBar?
Thanks, Chair. And Madam Treasurer, thanks for your time tonight. You've done this for a while here. I think you're the longest serving countywide elected here in Washtenaw County. So you've seen a few of these cycles before. Does anything give you pause in your role as treasurer in terms of interest rates or in terms of anything else above and beyond sort of the normal ebbs and flows of the market, if you will?
The really unusual, difficult financial time came during the Great Recession. And the pandemic could have been as bad, but because of our federal administration, we were able, with all of the CARES money and ARPA money and the payments for childcare, I think that we were able to weather that. And the delinquent taxes kind of show that as well, because 17 million is right around the average, maybe a little slightly under the average. Interest rates were high when I came into office. We were running 5-6%. So again, that's not a problem. In fact, we're going to make more interest revenue. It is a very good thing for the county. It may not, the inflation is not necessarily a good thing for each of us as individuals, but having higher interest rates when your portfolio is a bond and municipal bond, treasury portfolio that earns interest, it can't be stocks. It's going to be good for your interest revenue. What is difficult is when you go through the changes. When you start to drop interest rates, you want to get out there as long as you can to maintain those high rates. But at some point they drop and you're just having to adjust your budget for lower revenue. Now, when they're going up, you're seeing those transitions and those changes can be difficult, but we'll settle in and I think you'll enjoy the revenue.
Thank you for that lesson. Thank you. I think you're saying nothing that you haven't seen before that gives you unique pause. So
Yeah.
Thank you. Thank you, Chair.
Commissioner Robbie?
Thank you, Chair. Thank you, Treasurer. Always appreciate seeing you, and you always do a wonderful job with your reports. My question is relating to current events in the banking and economic situation that we're in. You've always been a very careful investor, and I've appreciated that about you. I assume that you're tracking what's going on and are prepared for it, but just want to give you the opportunity to speak to it.
You're correct. And I had started to mention the banking thing and then it slipped my mind when I was answering the previous commissioner's question. But there's no question, but when a bank goes bankrupt, it's very, very difficult. Again, we're not in much of a different situation than we were during the Great Recession. The reasons for the bankruptcy are the same. You have officers paying themselves highly. You have risky portfolios. You have collateralized mortgage obligations and a lot of bonds that may have been leveraged. I'm not sure in this particular situation. And in the current law.
Commissioner Beeman is saying they were.
So in the current statute for Michigan, public funds investing, we cannot invest in banks that are outside the state. Now, there is someone who wants to change that, and there is legislation being proposed that would allow an entire array of riskier investments. And the County Treasurers Association and the Bankers Association and a few others are working very closely because I don't want to see riskier investments. Some of us who are very experienced treasurers, if we spend a lot of time each and every day with our investments, we could handle it. But not all of us have every single day, and not all treasurers in the state are really experienced. So, and believe me, all of you around this table know our state reps and state senator, and I'll call upon you for some help if and when that comes up.
To that end, I certainly would be willing to support a resolution opposing that bill.
I'm sorry, go ahead.
To that end, I would be happy to support a resolution opposing that bill if
We'll see what it looks like. It's not published yet.
yeah, so
thank you.
when the time comes, hopefully you can work with the chair to develop a recommendation for us on that, because I would be very supportive for our board to support the effort that the county treasurers. I know that last year this bill came up too, and I remember you calling me about it.
Yeah.
But I want to support your efforts.
I will keep this board apprised. Mr. Chair, if there are no other questions, I had just two more quick things.
Yeah, go for it. Are there no other questions? Keep it rolling.
I also wanted to thank this board. In last year, during your budget deliberations, you allocated $500,000. Thank you, thank you, thank you, to help prevent foreclosure. You allocated it in this year's budget for the bridge loans. My staff has been working with the staff of the finance office to establish a special revenue fund so that this isn't just money that flows in and out in some haphazard fashion. There is a special fund established in the general, on the general ledger so that everything can be tracked and be traced. And we had some pro bono assistance from a law firm here in town, Conlon Philbrick. Her name was Marge Dixon, and she did all of our loan documents pro bono. And then our corporation counsel has reviewed those documents. We put a lien on the property so that the money will eventually roll back into the fund, and it will be a revolving fund. But since your allocation started in January, we have made 4 loans now. And it will be a very strong program to prevent tax foreclosure. Bridge loans, which you provided the allocation for, is also coupled with Home for Generations that I manage jointly with the probate judge. And Home for Generations has won a whole series of awards from the Bar Association here in Washtenaw County for the pro bono work. The attorneys have put in 660 hours of pro bono work. We've returned $1.6 million in property wealth to families in this county. The program has cost $1,200 because of all the pro bono work. We received a NACO award from the National Association of Counties as well. And the other program that my office has been, we created it, we manage it, but we worked with IT in the creation, is called robotic process automation. So we have IT purchased some software that you basically program with very fancy Excel spreadsheets. So they can be replicable throughout any public entity, but very few public sectors are using it. It's mostly in the private sector right now. And this robotic process can go out to a secured file transfer site from a bank, pull down our bank records, transfer specific information into what the county sees as a transmittal, and then transmit that directly onto the general ledger. So we save time, but we also save an error rates from those duplication of continuing to do input from one section to another section to another section. And our robotic process program last year was the first year of operation, and we won 2 awards at the end of the year. A very prestigious award from the Government Finance Officers Association. My chief deputy and I have been asked to make a presentation in May at that association and to teach other governments how they can implement this. And then we just got a recent award from Tyler Technology. And that, I think they're making a presentation there as well, I'm not sure. So I just wanted to let you know that we continue to try to cut costs and create effectiveness and efficiencies wherever we can for you.
Thank you. It's good to know the money is being put to good use. Did you have one other item?
I'm sorry.
Did you have one other item? You had one more thing?
That's it.
That's it. Okay, well, tk you very much. Thank you for being here.
No, or do you have a question?
I don't have any questions. Does anybody else have a question?
Nobody can see I'm smiling.
Yeah. Well, we appreciate your time tonight and for hanging in here with us to almost 8 o'clock. Thank you. Okay.
Thank you very much.
Yep. All right, we're gonna move on to a resolution approving the commercial rehabilitation district for 300 North Zeeb in Scioto Township. I know that I think we have someone here to speak to that.
Yeah, Chair, there are actually 2 representatives. We have Mark Smith, who is with the developer, my HQ, and then we also have Scioto Township Supervisor Will Hathaway.
Thank you for being here.
Grow in Scioto Township in Washtenaw County are, I think we're the direction we want to go.
Pleased to be here. I really came to answer any questions. Our board recently approved the creation of the district. That's the first step. And then the next step would be consideration of the application for an abatement. That has not occurred yet, obviously. But if the Board of Commissioners gives its okay for the district, that would be the next step.
All right. Do we have questions? Commissioner Sanders, now you got a question.
So you mentioned jobs. I'm interested in trying to get some understanding about what type of jobs, and are these jobs being offered to a workforce in Washtenaw County that will occupy those positions? Got a couple questions. I also wanted to ask, for transparency's sake, if there are any connections or any ways that elected officials and the developers are in any way connected or will benefit from this. I'm just being transparent. I want it out there for the residents to know that there are no hands being greased by this request. So you won't be the only ones that get this question. But also, I think the last question is the land already owned by the developers? What if we said no, then what? So that's it. I think 3 is enough.
Thank you for your questions, Caroline. Jobs, we do try to focus on jobs with building jobs and building companies that will put down roots in our community. We have a good working relationship with Eastern Michigan University. We're cultivating our relationship with Washtenaw Community College, and we have a good relationship with the University of Michigan with the intent of job training and internships that will help pull students into these jobs. We've got a long track record of building high-tech companies, like mostly in the life science, material science, drug discovery areas, and they are sort of a special workforce that need lab skills, some chemistry background frequently. But we are very much trying to connect with university students to try to keep them in our community. As far as will any of the elected officials benefit from this? No, we have no working relationship with other than our open relationship in asking these requests. Being active participants in Scioto Township, I've been a lifelong resident of Scioto Township. They've had several things before the Scioto Township Board of Trustees. But no, there's no quid pro quo, I guess, or kickback. Is the land owned? Yes, it is. We had to close on it under our terms of the purchase agreement. We had hoped to do this last year, but through scheduling and delays, we were not able to get this issue before the Board of Trustees to move it forward until early this year. So we renegotiated our purchase agreement, reducing our initial upfront cost and spreading some of it over a longer period of time to try to reduce our risk.
Follow up. It would be helpful, I think, for me and maybe for our residents, if when we talk about the money that the county would be foregoing, if this is approved, which it's not a lot, but 190,000 or something like that over the 10-year period of time. It would be nice if we had some sort of information that would help us explain to our residents, yes, we're foregoing this amount in taxes, but we can assure you that we are going to be receiving this amount in return in terms of jobs and money put back into the county. I think that would be helpful.
Sure.
And then the only other thing I wanted to suggest is that in relationship to the entities that you are working with for your skilled labor, I would recommend that you reach out to Michigan Works Southeast so that they have an opportunity to help you find potential workers that they can then help cover the cost of the training. And even possibly, the first couple of months of their employee, they have programs for that. And I think often some of our larger employers maybe don't utilize them the way that they should. And that's just my plug because I sit on their.
No, I think that's a great point to bring up. And that is one thing we have talked to, not so much Michigan Works in Ypsilanti, although I have had communication with them. It's more been about trying to set up programs for the employers that we're bringing in that would be very specific to the jobs that we're creating. We're doing very unique manufacturing and assembly here in microfluidics and wafer fabrication and battery assembly. So it takes a unique skill set that almost has to be trained on the job. But we're very interested in working with the Michigan Works folks to customize a training program so that we can bring those workers on. Absolutely.
Thank you.
Commissioner Robbie.
Thank you, Chair. Thank you both for being here today. Just had a few questions for you on this. So building off of the questions that were already asked by Commissioner Sanders, can you describe for everyone the exact nature of this tax abatement that you're asking for? Because I have an understanding of it, but I just want to make sure we're both on the same page here.
I'll do the best I can as I understand it. This is commercial rehabilitation district or tax abatement. We're taking an obsolete building which is blighted and been sitting vacant for more than 12 years now and trying to repurpose it. It has some good bones, but it also has some legacy issues in the fact that it's got a lot of asbestos containing materials inside. There are some VOCs. The previous use of the property was converting printed material into microfiche for storage, and then ultimately for microfiche into digital media for digital storage. In that process, that there was some VOCs left behind inside the building, as well as some heavy metals in one of the exterior ponds. So the best way I can describe it is we have to go backwards to be able to go forwards. We've got to clean up the property to get it to a point where we can start to move forward to repurpose the property, design it, relay it out so it's useful for our needs.
Thank you. And to your knowledge, what taxing jurisdictions would be impacted by this?
Well, Scioto Township, certainly, Washtenaw County and the schools would be affected. And I don't completely understand all the capture mechanisms, but some of the new tax revenue that we would create would be captured for reimbursement to me and then to your brownfield authority in its revolving fund to help pay some of the administrative costs and also, I think, contribute to that fund over the long term.
And so just to make sure I understand what you're asking for too, today we're voting on the commercial rehabilitation district. You're also going to be coming back with the brownfield
That's correct.
proposal.
That's
And
correct.
I assume that's already gone through the brownfield authority or it's working its way through. Have you already made the application?
We have, and I think Nathan Vogt is on.
He's on. Okay. Do we want to bring Nathan in? What do you want? Nathan
I'd be
in for?
okay with, yeah, if Nathan can give us an update on where things are at in that regard.
Love a surprise guest.
Surprise guest.
Hey, everybody. Thanks for having me. Good evening, everybody. Yeah, so I've been working quite closely for a number of months with Mark and with Will and with the township manager, Mark Thompson, and just kind of walking them through what this looks like in terms of the abatement, which does impact the TIF capture because it lowers the upfront taxes, which helps the project itself stabilize, supports the project's first number of years. And then on the back end would be these brownfield activities that Mark was mentioning, the asbestos removal, some of the interior reconfiguration, which are all eligible as sort of obsolete and blighted and brownfield activities. And then having those costs then reimbursed on the back end in the later years after the abatement ends to help the developer kind of cover those costs, finance those costs. So rest assured, I've been working with them very closely, trying to guide the process and make sure the township understands how the abatement plays into the TIF reimbursement, our role as the county in helping the township administer, capture those funds, reimburse them. So there, as Mark said, they've applied, made formal application. I've got a subcommittee of my Brownfield Authority members working with the Brownfield consultant, the environmental consultant, working with Mark and the township on getting a draft plan done. We're very close. I think it's going to go to the township in the next month. And then the Brownfield Authority, of course, will see it. And then you all, of course, will hold the public hearing and adopt. So I anticipate maybe a couple months from now, you'll see something.
Okay. Thank you. If I could, Jerry.
Go for
it. Follow up. So just to be perfectly upfront, I mean, from a philosophical perspective, I think I've taken a position in my legislative and public service career that is somewhat skeptical of these types of agreements and foregoing tax revenue for the purpose of private profit. I mean, I'm not, but that's what it is somewhat antagonistic to what I generally support. And so I don't know if I'll be supporting this one today, and I do apologize to my friends at Scioto Township for not speaking with you earlier about this. But this one does not filter well with my ability to support something like this. I will say, though, I understand, and I've always understood, Nathan and we've talked quite a bit about this, the need for, brownfield projects. And there's, because we're paying for an environmental cleanup, and in the absence of things like polluter pay, which is a bill that myself and Senator Irwin introduced during our time serving together. In the absence of things like that, these contaminated sites need to be cleaned up. And so, supporting that public benefit in that regard is something that I would be more open to. But a general tax abatement for the purpose of basically fixing up an old factory, I don't know. I have personally have trouble with that one. So I might just have to vote no on it, but I appreciate both of you for being here today. And I do apologize to my friends at Scioto Township.
Go ahead. You got a response to that?
Well, I just wanted to comment. The board in Scioto Township had a similar reaction. This is not something that Scioto Township has done before. Commercial rehab district is new to us. And this current board has not dealt with any kind of tax abatement issue. Actually, we had one application that we turned down for an IFT, creation of a district for that. This, was met with skepticism, and one of the biggest skeptics on our board volunteered to sort of take the lead in investigating it and determining whether he felt that it merited any kind of consideration by Scioto Township. He's a business person as well as a township trustee. And he and I together toured the site with Mark, and then Trustee Brazeau did a lot of research and work on his own, looked into the numbers, and his recommendation to us was for a sort of a limited abatement. So what I think the figure that you were looking at is for the full 10 years. And I can't predict what the board will do, but with certainty, but I'm confident that is not going to happen if you were to approve this district. I think we're thinking of something much more limited in terms of the duration of a commercial rehab abatement.
Thank you, Chair. I just have a follow-up question to that, which is, I know that there's conditions in which abatements can be extended. And I think that if I remember correctly, understanding this piece of law is that those conditions have to be built into the initial abatement agreement. So I don't know if you could speak to that, like what you have built into this. Maybe Nathan can speak to it.
My understanding is that with this act, there is no provision for extending. I think it's a 10-year maximum, but I know that Jennifer at Ann Arbor Spark was also helping with this piece. And so I can't speak with absolute certainty that that's the case.
I guess maybe I misunderstood then. I'm sorry. So it will be a 10-year abatement, or is it going to be a shorter period than 10 years?
It's up to 10 years, if
It's
I
up
understand
to
correctly.
10 years,
And so if you get done with that piece in 2 years, then the abatement's over. Is that?
My understanding, and again, this is our first commercial rehab abatement that we've ever considered. My understanding is that we, as the local government body, would consider the abatement application and make a determination as to what we recommend to the state. It's the state that has the final say, but I might expect that we would be recommending something much shorter, something like 2 to 3 years rather than 10 years.
Got it. And so to that, it can be extended up to 10 years, even if you just approve it for 2, it can be extended for up to 10 years. And so maybe we don't know the answer to this yet, but my question generally is, what are the criteria going to be for extension if we get to that 2 years? And I think that is provided for in the law. Yes, Nathan, you're right that it can't be more than 10 years, but if it is a 2-year that you're submitting for 2 years of tax abatement, it can be extended up to 10 years, but there have to be criteria listed in the initial abatement. And so I'm just wondering what those are, if you know them now.
Sure. We didn't actually attack the question that way as to what would be entailed to extend it. We actually talked about what could be done to cancel it if I did not perform. And that was really the approach we took. Our request was for 10 years. And with that, Trustee Brazeau had raised some questions about what can we do? What if you don't perform? What if you don't bring the jobs you said you would bring? And I believe that the program itself requires an affidavit be filed every year that we're in compliance with our goals. And we have no problem setting those goals in advance to show, mile markers and milestones as we go.
I have one last question.
Finish it up.
Thank you. Does your build out or the staff that you plan to hire, are either of them covered under a labor agreement?
The way we operate is a little unique. We run My HQ, which is more of a co-working community where we help support lots of companies that reside under one roof. So in as much as there's labor agreements, and those are really with the companies that reside there, not with us. We provide the really hard to find infrastructure, support, coaching, sometimes investment direct or indirect, cross-pollination, sometimes capital equipment to help these companies, which are frequently underfunded in the early days, grow and thrive. And that's, our mission is to grow companies that'll put down roots in the community.
So I guess then to narrow my question, eliminate the second part of my question, just the first part.
Yep.
Is the build out going to be done by union construction workers?
We have a GC that will put those out to bid, so we don't ultimately decide who gets, it comes down to who's bidding on the project. Some of it is in-house labor that we use. And, they're either employees of my HQ or our, company, or they're independent contractors that, are off doing their own thing, other hours of the day and night, HVAC contractors and. Yep.
Thank you, colleagues, for my patience. I'm getting to you. I just want to say that I'd like for everybody to get all their questions out at once. That's why I haven't gotten to you yet, Commissioner Somerville. I know you thought I forgot about you. I didn't forget about you. So I'm gonna get you now. And then try to get all of them you got right now, so I don't have to circle back.
Thank you. Hello, thank you for being here and taking our questions. So I totally get what this project is. Mine is somewhat just related to my HQ generally. So are you still expanding in the city of Ypsilanti, downtown Ypsilanti?
Yes, we are.
Okay. I just wanted to clarify that. So you're still expanding in the former College of Business,
Yes,
and this project won't impact that at all?
correct.
Okay, thank you. That was all I wanted to know.
That's it. All right, Commissioner Scott.
Thank you, Chair. I think that my questions are probably maybe asked a different way or trying to get to some other issues about this. So my understanding is it's like, a workspace basically, and helps people get their businesses going. Do you have a potential client list now for people that will want to move into that space?
We do. In fact, the reason there's time sensitivity is we have a number of companies that we've incubated and are growing and are now transitioning into manufacturing from prototyping or R&D. So we're going to cover lots of different spaces there, such as batteries, microfluidics, wafer fab. We have a polymers group. So it's a broad base that needs some unique but shared infrastructure that it's more efficient for us to do it together. Internal spaces such as conference room, kitchens, bathrooms are all shared. That's common areas. And then each company will have its own unique or dedicated suite.
So what kind of return can we expect to tell the taxpayers about why we're forgoing this tax money? What's the ROI for taxpayers and how soon could they expect to see that?
Jennifer Olmsted at Spark did a initial impact study. It's kind of hard to quantify. Most of the jobs that we're bringing in are advanced degree, $100,000 and up. Certainly locating, we anticipate 250 to 300 people on that site when it's completely built out. So they will certainly be staying in the community, shopping in the community. I can't speak to whether they'll reside in the community, but I expect they will. We have a number of tenants that currently reside in the area that will be moving over there. And then we'll backfill the spaces that they have at our current location with either new companies that are waiting to come in or expansion of existing companies that are trying to expand in place.
And my final question is, so part of this is doing this brownfield remediation, but some of these manufacturing ideas seem like they create their own brownfield in a sense. So
Well,
how do we protect against, once we remediate this brownfield, creating another one?
yeah, so that's very tightly controlled. We do have a number of chemistry companies, but we're talking about grams and microgram kind of reactions, manufacturing RNA and DNA, microbubbles in clean fluids. But everything is goods in, goods out. It's got to be accounted for in the reaction. It has to be transported out and disposed of properly. We have to keep records of that. So we, along with the tenant, work with Veolia, Clean Harbor for collection of any hazardous materials. Every company has to go through a lab procedure and manual and operations critique before they can operate. And then they have to follow that and they get checked up on multiple times per year. Yep.
Thank you, Chair.
You're welcome. I wasn't expecting to hear about micro bubbles when I came to the meeting today. Commissioner Machieski and then Commissioner Beaman.
Thank you, Mr. Chair. Thank you both for being here this evening. I do want to note for my colleagues that there was written public comment from Ann Arbor Spark submitted that supported this item tonight. I do want to acknowledge Supervisor Hathaway and the Scioto Township Board for their diligence in exploring this particular opportunity. And, looking at it, I think they're getting a sense tonight of how seriously we take requests like this. And I appreciate the process that the township went through. Many of my points have already been covered tonight, but I do want to ask about Zeeb Road. Supervisor, we've had discussions in the past about Zeeb Road, and particularly the traffic situation north of 94 in particular, where this facility might come to life. Could you please comment about the potential impact of up to 300 people at that facility, and if anything would be needed on Zeeb Road?
Well, we haven't done a traffic study a formal traffic study, but Trustee Brazeau actually did an informal traffic study. He went and basically parked at the entrance, the curb cut right into this 300 North Zeeb, and watched traffic closely for a period of time, an hour or so at 3 different occasions. And gathered information. There was particular concern about the impact of cars making left turns onto Zeeb Road. If you are familiar with that section of Zeeb Road, there's a number of businesses on the opposite side. And it's right at the highway exchange with I-94. And he determined that there was really, in his view, not a problem. He saw plenty of opportunities for exits, in part because there's a traffic signal that stops the oncoming traffic and that allows ample opportunities for left turns out of the site. I should add too that there was another proposal for development of the site by a prior owner. They never really got all the way to an actual formal proposal, but their informal proposal drew a lot of negative reaction from the community because it was a very dense development. This development has met with support from the adjacent property owners because it's basically using the footprint of the existing building. It's just sort of rejuvenating it after it's been, lying as sort of a blighted industrial site for over 10 years, I guess, over 12 years. And so I think there's a lot of enthusiasm, which is, in my experience, I've served on the Planning Commission for 10 years, and it's unusual to see a lot of enthusiasm from adjacent neighboring properties when there's a proposal for development. But that is the communication that we're getting. And that's in some ways sort of encouraged us to look at this more positively than we might have otherwise.
Thank you. I look forward to supporting this when we get to a vote on it this evening. And thank you again for coming in. Thank you.
Commissioner Beaman.
Thank you, Chair. Mine is almost more of a statement rather than a question, so I'm going to apologize in advance. So this is my wheelhouse. This is my background. My background's in economic development, and for full disclosure, I'm a former employee of Ann Arbor Spark. I no longer work with Jennifer, but know her very closely. So I am just really excited to have this type of innovation come to our area. It's needed. We have the growth. We have the university, which is now my day job. And I'm just really, really excited to see this type of investment within Washtenaw County. So I want to thank you for bringing this forward to us today.
Last call. Oh, Commissioner Sanders.
Just a quickie about the traffic out there. I have friends and family that live pretty much abut to that property. And traveling out there, I don't know that my concern would be near I-94, but if you are traveling on Zeeb like you're going to Dexter, it can be a headache depending on which way you're trying to get out onto Z. So it would be nice if we could get if you could get some sort of traffic study that's official, that may be able to provide you with additional traffic support. Because I think 200 or 300 cars would make a difference. And God bless them, there's still some stray deers out there too.
Oh, yeah.
So between them and the cars and the way that people coming from that residential area, if you're trying to if you're coming west towards Z from the residential and turning left, you might be sitting there for a minute waiting for the traffic to clear, and people, it's like an Autobahn out there. They don't necessarily obey the speed limit. So that's just my 2 cents. It would be nice if
So
you could have that done to help.
I'd like to comment, add to Will's comment. I did the same. I was concerned about that as well, the left-hand turn with the light being offset by about 100 feet and the left-hand turn lane that exists there now. I've never had to wait more than a minute. I was actually quite pleasantly surprised. I'll also say that we're going to be using the site at a lot lower intensity than it was originally used. We actually think we can reduce the parking impervious by over 100 spaces. There's currently about 500 spaces. We think we can cut that back to about 400 or 375. So we're going to be using it at a much lower intensity.
If I could just add, if the footprint of the building is changed, and Mark in discussions has indicated that at some point, down the line, that might occur, that would trigger our planning process, a site plan review and a traffic study. So I guess in a sense, there's sort of a built-in trigger for if this, assuming this succeeds, this goes forward and it expands, then there will be the traffic study as it expands.
Commissioner Light.
Yes, Commissioner Scott had asked what the anticipated return of investment was, and I didn't quite catch what that was. We went on to something
Right,
else.
Yeah, I'm not sure I can quantify that in a dollar number. I mean, we're going to be adding high quality jobs. I would have to defer to Spark and Jennifer, because they've started an impact study or have done a small impact study for this project. I don't know that we can draw real conclusive data out of it because it is generalized, but it will certainly be a positive economically to Scioto Township and to the county.
I can add something. I don't know if this will answer your question, but I learned as we studied this site that its current tax valuation is now way, way down. It's below what it was in the 1980s, which is when the baseline was set for our Downtown Development Authority in Scioto Township. So in fact, in terms of the Downtown Development Authority, it's underwater financially, and the DDA is actually having to sort of pay to make up that difference because it's so far below its tax valuation of 30 years ago. And so one of the hopes and expectations is that as this development succeeds and begins to thrive again, the tax valuation will come up, and that would be, I think, from the county's view and all of the taxing authorities, a return on investment, a benefit that would yield way more than we're talking about in terms of a 2 or 3 year tax abatement.
Right. If you're asking about the specific numbers that have been projected, I think we're looking at something sub $2 million valuation today, up to an $8 million valuation in 2024, 2025. So if that helps you quantify it financially.
Yes, that does. So with the taxes, once the property is renovated but wouldn't that increase the taxes once it's assessed? Since it's back from in the 80s, and that's what it is now, but once it's occupied and then it's assessed, won't it change and it could increase and kind of take you over the top? So how is that going to work? Is that going to change, or will that
take us over the?
Well, I'm just saying, will it increase greatly the taxes? Because if it's the same from like the 1980s, after it's assessed, after it's been developed, wouldn't the taxes changed? Wouldn't it have to be assessed again once, or is that just with like home ownership?
it will be assessed again with all the improvements. I believe Will's pointing to a valuation that was established in 88 of $4 million. It's down sub $2 million now, and that's the underwater. It's gone negative for the DEA, so they're actually subsidizing it. When we bring it forward, I believe the projection is an $8 million valuation in another 2 years' time. So that's going to double it, even its 1980s valuation. So the answer is yes, there will be more taxes collected. Some of that will be reimbursed through the different programs that we're talking about to help cover the cost. But the county, you're not going to go backwards in revenue.
All right, I think we're ready to wrap it up. Appreciate the presentation and thank you, Nathan, for sticking around this long. I don't know if you know, but you've been on screen this whole time. Thank you for your patience. I'd say that I share some of the philosophical concerns that Commissioner Robbie mentioned earlier, but the thorough presentation and how deeply you've all looked into it and the support from my colleagues in the western part of the county make me feel, along with the plan for this to only be a 2 or 3 kind of year thing as opposed to a 10-year one, makes me confident about my plan to vote yes on this. So I think it's a roll call vote time.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machieski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott, Commissioner Somerville.
Yes.
Item passed. All right, thank you very much.
Thank you very
Yep.
much.
Yep, and thank you, colleagues, for indulging me and taking those 2 before we do the final vote on the other ones. I knew we had special guests that would want to leave immediately as they are right now. So any discussion on the other chunk of items that we have there? Commissioner Robbie.
Thank you. Just a question on the resolution around local public health legislative and funding priorities. So I guess my only question there is, what are the legislative and funding priorities? There was an attachment to this document in there, but this appears to be a national network of public health institutes and the Texas Health Institute document. And the only initiatives that I can find in here are some pretty broad items. So I don't know if there was like a list of state of Michigan because it is the Michigan Association of Local Public Health. So are there state of Michigan related legislative and funding priorities, or what are we approving? here?
So I have the sense that Commissioner Scott and I have already seen this from Board of Health, and I think the items are contained in the whereas statements, but I think Commissioner Beaman is gesturing something to me.
I just have a point of order. We didn't vote on the previous.
The one for the treasurer?
Yeah.
No, we did do that one.
No.
Yeah, we did it, and then
Yeah, we
she
did.
presented several other things after we voted. Is that right? Yeah.
Yeah.
Yeah, so I believe, correct me if I'm wrong, Commissioner Scott, but I think the items from that are contained in the whereas statements on this.
Yes, thank you, Chair. They are, some of those things that if you look at it, are $3 million for rural community health workers, 40 million in flexible funding for local health departments, a one-time allocation of 250,000 to support comprehensive cost analysis of local public health services. Essentially, when we had this presented at the Board of Public Health, it showed how in the current budget, the funding that's being presented at the state, Governor Whitmer's budget, the funding for public health is going up appropriately so, since it hasn't in most states since about 1983 or 79 or something like that. Don't quote me on the year. And so we're appropriately increasing funding, but need to increase funding for public health even more, because that funding is probably only getting us up to levels that it should have been in like 1990. And so this works to try to talk about how you can strengthen public health departments even more by helping provide money for controlling infectious disease, for how you work with sexually transmitted disease, for all of the things public health departments have to do, but then go beyond that to try to really impact people's health on a daily basis. That addresses things like social determinants of health. So that's what this resolution is designed to do, to say that we support those same initiatives that I can't say it like how Jimena says it, MPEL or
Mouth. Yes.
Mouth sounds dangerously close to something else, but mouth. And so we felt like it was an appropriate thing for us as a public health board to support, and hope that we could bolster that support by bringing it to the Board of Commissioners to have that support going forward too.
Beautifully said.
Thanks.
Thanks. Yes.
Yeah, I do have a follow-up on that. Thank you to Commissioner Scott. Got a good laugh out of that one. So I do see it in the whereas clause, and I did read that. The issue that I was having was it says also include, and then it lists the ones that you just talked about. So I didn't know if there were others that were not included in the whereas clauses. That was sort of the implication of the resolution. And in the resolved clause, it does say the legislative funding priorities approved by the board of directors. I'm not even going to say the organization. But that is, so I just didn't know if the resolution, the whereas clauses contained the full priorities. And I wanted to make sure I knew what I was voting on here.
You should always know what you're voting on. Yeah. Is there a question in there or?
The question is it in fact all included in the whereas clauses, or are there others? It implies that there's others out there, other priorities.
Commissioner Scott?
I think there's other priorities in the sense of like, you're talking about like what you have to do for like public health workforce. Like we've talked about that at this table before. So how you can do workforce development for things in public health, like that. If you are a nurse who wants to go into public health, you are sacrificing a huge amount of income compared to nurses who work bedside. And none of that nursing is more important. My work in the ICU is no more important than a public health nurse does at the Washtenaw County Health Department, but the funding for both of those positions is enormously different. And so some of those legislative priorities we'll be talking about, how you fund workforce, nursing, how you help fund community health workers, how you help fund home health aides, all of those things I think are kind of included in what you're talking about with public health funding. So I don't think that we are limited to what we see in that resolution, but I think we're focusing on what's good for public health.
So before we go any further, Andrew, can you patch a special guest in?
Another one,
Yeah.
another one.
Chair, I think you're talking about the county's health office.
I am talking about the health officer. Well, welcome, health officer. Thank you for being here.
Amazing, the magic of technology. Good evening, everyone. Good evening, commissioners. Thank you for considering this resolution. And yes, I just want to clarify that the resolution includes the priorities that were identified and voted on by the board of the Michigan Association of Local Public Health. And when that was approved by the board of the Michigan Association of Local Public Health, it was meant to be sort of a living document in that we know as the year progresses, there may be other legislative and funding priorities that are identified. And so I anticipate that over the course of the year, there may be other issues that get added to that priority list, but we wanted to at least start by showing that the Board of Health was in support of these funding and legislative priorities. And so the resolution that is before you is pretty much exactly what the Board of Health passed also.
All right, I'm getting a thumbs up from Commissioner Robbie. Do we have other questions? I think people are feeling good about it. Okay. Thank you, Jimena. So do we have other items you want to discuss? Remember, we're voting on the package here of items. So any other items to discuss within the remaining resolutions to vote on? You're good? I'm feeling that the vibe is good. Okay, so before we do the roll call vote, I'll just say a couple very briefly about two of these. We do have the resolution proclaiming March 2023 as March for Meals on Wheels month. And I think it's a pretty good resolution. I'm grateful for Ypsilanti Meals on Wheels for working with us to get this together. I would say that in addition to thinking about the work that Meals on Wheels does to get nutritious foods to our seniors, the work that they do to combat social isolation is also really critical and something that I see being discussed more. So I just want us to be conscious of that. The other item is a resolution proclaiming March 2023 as Social Work Month. Every March is Social Work Month. I'm glad we're doing a resolution to proclaim it here. That I will want to take it as an opportunity to thank the many social workers that work for Washtenaw County. Social workers, here's a fun fact, in our country. Social workers make up the largest mental health workforce. So I want to give a special thank you to all of our social workers in community mental health and the social workers that we have in our health department and all of the other departments. Social workers do a lot of things besides mental health work. They do policy work and they work in community-based organizations, a wide variety of things. So I'm very glad to have both of these on our list here. And our health officer is a social worker, as am I. Great. Now I think we can do a roll call vote.
Commissioner Hodge.
Yes.
Commissioner LeBar,
Yes.
Commissioner Light,
Yes.
Commissioner Machieski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville,
Yes.
and Commissioner Beaman.
Yes.
Excellent. So for our viewers at home, we have just voted to approve the remaining items in the resolution section. Now we're moving into report from the county administrator, and I think we have another special guest. You might have an additional report.
If you're referring to me as a special guest, I certainly appreciate the accolade, but I am joined this evening by our Director of Children's Services, Kevin Mitchell. I asked him to provide you with just a quick update on the Children's Services programming. Kevin? I like how Greg said it was a quick update. I will try to make it as quick as possible. I know it's rolling at 8:30 right now. I'm Kevin Mitchell. I'm the Director of Children's Services. Just wanted to thank Greg and all of you for the opportunity just to provide an update tonight. So Children's Services is comprised of two departments, or excuse me, two programs. It's a juvenile detention program that is secure. And we also have a non-secure program that's our juvenile day treatment program. Our facility is staffed 24 hours a day, 7 days a week for 365 days a year. Facility opened in 2003 and it's about 34,000 square feet. We have 32 full-time employees when we're fully staffed and 4 on-call staff. I can't say enough good things about our staff. I know Commissioner Hodge, you were just talking about social workers, but we've got a lot of them in our building. Our staff do a wonderful job of working with kids that have a lot of challenging behaviors. So, and to support our staff, we typically have between 40 and 60 hours of training annually. And for new staff, it's typically a little over 200 hours. A real quick overview on our budget. Both the Children's Services programs leverage outside funding well. Detention leverages about 61% and the day treatment at 58%. Biggest contributor for us is the state child care fund that matches all of our expenses at 50%. And then there's an administrative allocation as well. It's 10%. Going to dive into our juvenile detention program real quick and just talk about who we serve, programming, and some of our metrics from 2022. So in 2022, we served kids between 11 and 18 years old. All of them were court ordered into the facility. 76% of the kids identified as male. And that is a pretty common number for us, between 75 and 85%. Also, unfortunately, it's also common for us to have a large number of youth of color in the building. Last year, 83% of the kids from Washtenaw County that came in were youth of color. We do take kids from out county. Sometimes when they're arrested here in this county, we hold them for a little bit until they're transferred back to their county, or we take kids for courtesy at times. But last year we had a total of 176 admissions, which is about 33.6% higher than what we saw in 2021. So we're trending in not the best direction right now. New charges are the biggest reason why kids come into the facility, followed by just a violation of their probation and kids that are on the active warrant list. So last year we had kids come into the building for domestic violence, which was the most common reason why kids were being sent to the detention center. Assault, breaking and entering, robbery, sexual assault, murder, theft, and then we had several school threats, kids that came in with that charge. The typical age, and we will take kids from 11 to 17, but the most common age we saw last year for kids was 15-year-olds at 26%, and 17-year-olds, the group that grew the most at 24.1%. Our highest daily census was 17 kids. That's just for Washtenaw County, and our lowest was 6, and our average length of stay was 23 days. That went down a little bit from last year, which was 26, but that is still about twice the amount of days kids are staying here on average than they were prior to the pandemic. And a lot of that's has to do with the availability of treatment beds and the availability of detention services. We have a crisis in our state right now. When kids are in the detention program, they get structured programming every day from 7:30 in the morning till 9:30 at night. So there's not a minute where we don't have structured programming going on. There's been a lot in the news lately for some detention centers that are leaving kids locked down to 23 to 24 hours a day. That is certainly not happening in this county. While the kids are in the detention center, they receive medical and dental services, psychiatric services. We have community mental health. We are working with a psychiatrist 1 day a week. And then we have contracted with CMH for a mental health professional in the building as well. That's there 40 hours, and she conducts group and individual counseling. In juvenile detention services, there are some common metrics that are measured nationwide, and I just have a few of them here. Last year, physical interventions for us were down about 50%. We had a total of 5, and that's out of 176 admissions. We had 0 youth injuries, 5 staff injuries, which was down about 30%. And then our workman comp days in total were 4, which was down 87%. Our licensing that came in, which is usually 2 to 3 days once a year, and then they have 4 drop-in sessions. We've had a long streak of having excellent licensing inspections, and last year was the same. What we've noticed now is licensing is referring us to other struggling programs to come in to see our program, to walk through our building, to talk to us. And then one last thing I did want to mention, last year we went 10 months in our detention center without a physical intervention. That's again, just a testament to how great our staff are. They're just so willing to de-escalate situations by talking about things, which is just excellent. Real quick, these are our partners in our detention program. I'd love to talk about everyone I know. We're a little short on time tonight, so I will not, but we have a lot of outside programming coming into the detention center. Second program I want to talk about tonight is our juvenile day program. So last year was our first year that we piloted. We served youth that were between 13 and 17 years old. All the kids are on active probation. And most of our referrals were coming from the intensive probation caseload, which means kids who are really in the community under increased supervision. We served 19 total youth that were enrolled in the program. And I always like to say to people, a day in day treatment is not a day in secure detention or a day in out of home placement. So we just really owe it to the kids and to the families to treat them in the community first before we're sending them out somewhere at $400 or $500 a day, and then they come back and have bad outcomes. So there are 3 major components to the day treatment program. The first is academics. We have kids at the Washtenaw Alliance for Virtual Education. Many of the kids that come into the building, into this program, have not been to school or 2 or more years. They have either 0 or very few credits. So they're really focusing on credit recovery. Another portion of the program is life skills. You see a picture here. We have 2 probation officers that are very handy, and they are teaching the kids rough framing, drywalling, electrical, plumbing, door trim installation, and just tool safety. So kids are learning how to do these things, and they're being exposed to it because some of them may hopefully be interested in going to some of the trades. And the third piece is the clinical piece. We have community mental health as our clinicians. So we have group therapy multiple times a week, individual therapy, and then family therapy. And just a quick look at some of our partners in juvenile day treatment. Just want to talk about the results after the first year. So many of the youth that were enrolled in the program last year in 2022 are continuing to be in the program this year. School participation increased significantly. So in the first semester, our kids earned a combined of 20.6 credits. Again, these were kids who, many of them had no credits going into this. And I think the biggest piece for treating kids in the community in this program that are actively on probation is that we had a reduction in new charges and a reduction in delinquency. Just want to mention COVID-19 and residential care. Our group that we have in our building has really been through a lot over the last couple of years. just wanted to say that I've been doing this for 26 years, 23 of them here in this county, and have never seen anything like what I've seen in the last 2 years. So just a mass departure of direct care staff, managers and administrators out of our industry, a treatment bed shortage and a detention bed shortage in our state, and then just facility closures because a lot of facilities are just not taking good care of kids. So I think over the last 17 months, we have 19 facilities that have been closed and 2 of them yesterday. At the same time, we had raised the age legislation. This county, of course, adopted that about 2 years earlier. It was really the perfect storm. A lot of 17s coming into the detention center and really an inavailability of beds. There were some good things from the pandemic. I just want to mention a couple of those. Our admissions initially went down about 75% in that first year. So another piece is virtual court hearings. But I've been an advocate for virtual court hearings for years. We don't have to take kids outside of the building and take them down to the court. It's difficult sometimes for their parents to get downtown. They can do the hearing right from home, and we don't have to take the kids out. Another big piece is the creation of the Michigan Task Force on Juvenile Justice Reform. We have a failing juvenile justice system in this state. The governor's task force identified 32 recommendations, and they're excellent. I hope at some point I can come back to talk to you all about that. Just moving forward for our department, our biggest departmental challenge is going to be hiring and retaining great staff who love to work with kids. Both of our programs are not fully staffed at this moment. We're getting closer. Another thing we're going to work on is coordinating with our finance department to utilize some of the RTA dollars. We had a lot of 17-year-olds come to the building last year, and we know that that money is sitting there to fund them at 100%. So we're going to move forward with that. We really have to work on enhanced training and support for staff so that we can keep them retained here in the county. And then just developing further programming for youth outside to come in to work with kids. Had a couple other slides on the governor's JJ policy recommendations, but I'll save that for another time. Just wanted to also note that all the art in the presentation was our kids' art that were in the youth center. And they did that through our Youth Arts Alliance vendor. So
Thank you. Some good looking art. Commissioner Sanders.
I'm glad you mentioned the art because that was one of my questions. It's beautiful, but I also wonder if there's not some way that we could provide something to those youth that you utilize their art for. Because it's also a way of us letting them know that you can make a living as an artist. And, you know, I would just feel better knowing that we were able to provide them with some sort of stipend for their work because it's beautiful artwork.
I would certainly be open to
And
that.
not to sort of exploit them. Because I think they've already been exploited in some way or another, the fact that they're even in your programs. The other question is, are you able to share either now or later, whether or not you have any staff that have come through that have had lived experiences in settings like yours, either here or elsewhere, that may help them relate better to the youth?
Absolutely. Yeah, we have several staff that have lived experience. We also try to hire staff when we can from the community because they understand the community. And we want to hire staff that look like the kids often that they're working with, so they can mentor and be good role models.
What was my last question? My last question was, what is the longest that you have either housed or can house a youth?
This past year, we housed a young person for over 14 months. We housed the young person because they were waiting for a specialized sexual offender treatment bed. It was quite a long time.
Commissioner Beaman. I'll get you next.
Thank you, Chair. Mine is more of a statement. I just want to thank you for all the work that you and your team does. I wish it was not necessary. I wish we didn't need this. But for those of you who haven't toured the facility, I highly recommend you do. It's a very amazing facility. It was built to look like a school, which is why it does look like a school from the outside. And inside it is as homey as a place of this nature could be. And again, I just want to thank you. You've been through so much with the pandemic. Our kids have been through so much. And again, I wish this were not necessary, but for what you are faced with, it's an amazing job. So thank you.
Commissioner Robbie.
Thank you, Chair. Appreciate all your good work. Last time I was here, Lisa Greco was in your job and, you know, she showed me around the facility and I'm sure it's changed a lot. So I look forward to coming back and checking it out. My question was largely centered around education at your facility. And so you are talking, I think you were talking about a new program that you basically have. I'm trying to open it, the slideshow again now, but you have this new program, the day program, that's a new program, right? You're in the 1-year pilot period for
Yes.
that. So two separate questions. One is around those that are not in the day program that you service, where do they receive educational instruction from? Who delivers that to them?
The WISD is our educational vendor. It provides services inside our detention building.
Thank you.
So, and it's a mix of virtual and in-person teaching. So a lot of the kids come from programs that are already on virtually. So they come right in and pick right up where they were, but we're also doing some direct teaching as well.
Has that changed since the pandemic? Are there more kids on virtual programs now in your facility? Or was that the case before the pandemic as well?
It was often the case before the pandemic. But I think now certainly there are a lot of kids coming in that are enrolled in those programs. There's one in IPSI called ACE. There's another program, WAVE. We have a lot of kids in detention that come from the Washtenaw Alliance for Virtual Education as well.
So that was my next question is what is that? I'm not familiar with the WAVE program. Can you help
It's
me?
operated by WEOC, which is the Washtenaw Education's Consortium. It's a program that's a mix of virtual school and in-person. Our kids, we pick them up in the morning and take them to school, and we staff WAVE as well. Some of the kids might be at our facility 1 day a week doing school. Most of the kids are there at least 3 or 4 days a week in person doing their schoolwork with the WAVE staff. And then we bring them back in the afternoon for programming.
I guess I was wondering like what type, is it a nonprofit? Is it a charter school district? Is it a
Public school. Yeah, it's a consortium school. It's in the same as Washtenaw, YHI, Eastern Alliance. It's a consortium program.
So it's part of the IPSI Public School District or?
It's an ISD. It's an ISD. It predates the pandemic, if you're
But
wondering.
it's not a charter school.
No, it's a public school.
Thank you.
Anybody else? Seeing none. Well, thank you, Kevin. I hope to have you back to discuss the governor's JJ recommendations. And if you ever want to do like a career fair, I work at a school of social work, so you can always help with recruitment.
I will definitely follow up with you on that.
All right.
Thank you.
Thank you.
Thank you, Kevin. I just wanted to layer in on the comments. The staff and the leadership at the Children's Center is excellent. And I wanted to have Kevin before you to talk about the wonderful programming that's happening in the space. And then to lean in on Commissioner Beeman's point, that building is phenomenal, and the county employee that led the design and construction of that building back in the day did a fine job. So just wanted to.
That was you, right? Was that? Yeah, that's excellent.
One more item this evening, and we'll be quick about it. I had the great pleasure of making some opening remarks this morning at our Small Business Expo. It was a phenomenal event. I wanted to take just a moment to provide you guys with an update on this morning with a promise of having Sharnissa Roach and her team come and present to this board. I talked this morning about the ecosystem necessary to make small businesses successful. It was, in my mind, a very generative discussion. We had a lot of community partners in the room. We had banking institutions in the room. The MIDC, Spark was there, the Ann Arbor Chamber, MSU Extension. WCC, the University of Michigan, and EMU were all in the space, providing excellent counsel for and can you move through some of those photos? As you can see, the LRC was packed. And this, to me, represents an example of county government at its finest, because we are doing the work behind the scenes. We don't talk about it a lot, but I think our community of small business owners were really, really appreciative of the framework that we provided for them, the framework for discussions, access to services and resources. And I just wanted to bring it to your attention. It was a wonderful, wonderful a meeting this morning. So with that, I'll conclude my report.
Well, thank you for doing that this morning. That's fantastic. Excellent. Okay. And thank you for designing such a wonderful building. All right, we'll move on to report from the chair of the Board of Commissioners. I'll be really brief today because I can feel the vibes coming down. People are getting tired. So I'll say I'm going to attend the Washtenaw County Healthy Aging Collaborative Senior Transportation Summit tomorrow morning. Anybody else going to be there? Nope. There will be plenty of people there, I hope, and I'll have a detailed report when I come back next time. The only other thing I'll say is that we were joined for most of the meeting by a student from Huron here on an assignment to watch a local government board meeting. If the student and her mother were still here, I was going to direct them to the podium, but they left. I think they probably could sense that I was going to ask them to come up, so they left. But I think this was a really good meeting for a student or anyone else to watch. This was good. I think we did some good work today. Did all kinds of parliamentarian things. It was a good time. So moving on to one last thing, friends, before we start packing up. It's not over yet. We're almost done. We have items for current and future discussion. We do have one item here, and it is a mask recommendation memo from our health officer and our medical director. I'm not going to try to do them. I don't want to do them an injustice by saying anything about it, other than I'm going to just read the recommendation, which is that given the current community level of COVID-19 and the decrease in other respiratory transmission levels, we are supportive of removing the mask requirements at BOC meetings beginning April 1st, 2023, but continue to support individuals who choose to mask with high-grade masks for medical or personal reasons. If respiratory virus transmission activity drastically changes in the future, we will communicate appropriate changes to our recommendations. This is the thing for us to discuss. I don't know if Jimena is still on the call or if she wants to add anything else. If she's still on the call, thanks for hanging in there.
Thank you. Thank you, Commissioner Hodge. I think, the memo, I feel hopefully provides enough information. We have been at low community levels since the end of January. So we're seeing really a pretty stabilization of COVID at a lower level, which is great news. Our flu rates and RSV rates also have gone down tremendously. And while we were concerned about this new XXB.1.5 variant, and it is the majority of the variant that we're seeing locally, it hasn't resulted in a significant increase in cases and, most importantly, hospitalizations. So we certainly continue to monitor as always, but at this point we feel we've kind of achieved a sustained lower level that certainly supports this recommendation. And of course, as you say, people have the choice about wearing a mask if they feel more comfortable or have reasons to do so. And the other thing is not to forget all the other prevention measures that we can take in terms of, if you do have COVID, follow isolation recommendations. If you've been exposed, follow recommendations. Of course, stay up to date on your vaccinations. All of those kind of things remain in effect.
Excellent. Thank you. And thank you for all that you do for our county and for our county government. So always got to take the opportunity to thank the team. All right, so we'll take questions. I'll just also throw out here as we go through and take questions and discuss. If we wanted to accept the recommendation, the easiest thing to do would be for someone to move to rescind our previous resolution, which was resolution 22-008, based on the health department's recommendation. So just keep that in mind as we have our discussion in case anybody wants to move that. Commissioner Beeman, I saw your hand first.
Thank you, Commissioner Hodge. I'm excited to see us at these levels. My only concern is, as a mother with kids in K-12, April 1st is right when we come back from spring break. I'm traveling for spring break. All the families I know are traveling for spring break. So that could be like right when we start to see another spike. I'm not saying a huge lock us down type of spike, but we might see some increase. So I'm just wondering why that date was chosen.
Commissioner Beaman, I completely understand your concern. We chose that date because generally we see sort of seasonal patterns with a lot of respiratory illnesses. And typically by the end of March, and as we are seeing with these trends, we see a significant decrease in the respiratory virus transmission just because of the nature of where we are that time of year. I think if there are concerns about spring break, again, I think if you are traveling and your family has traveled or other members or participants have traveled, then, that is a great time to make a choice about wearing a mask around others. But again, I think by April 1st, we sort of typically see the seasonal changes that happen with respiratory viruses. And again, we think that we're seeing a pretty low stable pattern with COVID, and of course monitor that and would respond if we saw any spike. But at this point, it would take a pretty big increase in our case rates to get us to move from low to medium. And just so you know, almost all of Michigan, luckily, is at low community levels, with the exception of a few counties in the northern part of the Upper Peninsula.
Thank you.
Were there other hands? I don't know if I missed a hand. Commissioner Scott?
I was.
Oh, I'm sorry.
How
Commissioner
did he-
Beaman was just quicker. Yeah.
Okay. Okay. I had my hand up before I even started talking, but okay. It doesn't really matter when I go. I know that I will get there. Thank you, Chair. Jimena, I look at these numbers all the time, and I'm so happy it's low community spread. I feel really good about that. And I think that this memo was written on the 8th. When I keep looking at the wastewater trends, though, they look like they're up on the graph that the U of M has, like up 1,000%, and they're trending up.
Yeah, there's been a slight uptick, but again, we're not seeing that kind of translated for a significant increase in cases or the trends that we're seeing there. Again, these are all measures that we keep an eye on. I think the other thing that's important to remember is that there are some settings where recommendations are different. So, for example, in healthcare settings, and I'm sure Commissioner Scott, you're well aware of this, but in healthcare settings, the metrics that we look at and the recommendations are different. And so you'll find that in most healthcare settings, for example, they're continuing to require masks, as we are in our clinic at the health department.
I think probably my concern just kind of stemmed from one of the Commissioner Beaman's, that when you look at the 7-day difference, it was like 9.4, but the 14-day difference was 29.7 for COVID. I think this is more geared towards my colleagues, that if we were going to consider rescinding the mask mandate, I'd like to see us do it in a more nuanced fashion, and that it would maybe require a different resolution that rescinds 2208 or amends it, that when you get to medium level of community COVID, medium spread, that we would put the masks back on or require masks back for our meetings, rather than just having them come off and not having them go back on when COVID rates may continue to go up. I think that would probably be more beneficial for all of us. Well, I didn't make that. I didn't make that. But okay, I know I've got a supporter, so that's good. So I guess I'd like to see us be a little bit more nuanced rather than just a straight up rescind. I
Heard.
see Corporation Council maybe had some advice about how we might be able to do that.
I think what we're thinking about here is working with administration to bring you back something to that effect or a similar effect. We could work together to come back with something at our next meeting if that's the mood, unless somebody else moves the other thing, then we have to discuss that.
Thank you.
Yep. Are you, is that a hand? I don't know. I'm trying to, I don't want to miss anybody or get you out of order. Are you saying something? Your thumbs up in, okay.
Chair, we can certainly do that. What I would say to this body, if you want to use the more nuanced approach, is a simple amendment to the resolution. If Corp Counsel thinks it's okay, we can make that amendment now and then bring in. No,
That's not what the lawyer whispering the ear kind of thing was happening over here. It was a, we should do
tried.
that,
Okay.
what we just said.
Yeah.
Is that right?
Yeah.
I think just because it's late and I would think it would be appropriate to have eyes on the original resolution. And we can propose language for this board to consider that takes into account Commissioner Scott's request.
I know we're all eager to move forward, but diligence is key. Okay, any other thoughts? Thank you, Jimena. Any other thoughts, friends?
Is this other items for?
This is other items for current and future discussion. Are we done with this one? Feel like we're done. Okay, anybody got anything else for? Yep, Commissioner Scott, I see you.
Thank you. Thank you. I have one more thing. So a few of us went this week on this bus tour that was really illuminating. And I just want to note that whatever way we go forward, we must consider how we get funding coordinated again. So we have a limited amount of money in Washtenaw County. United Way had money, Trinity had money, and these places that are really important nonprofit partners are struggling in different ways because of COVID. And I just feel like when we don't, the funding doesn't have to be coordinated and given through one source, but we have to be able to come to a round table of some sorts and figure out who's getting the money. So there's not overlap of some places getting a lot and some places getting none. But the point was driven home to me so clearly about the work that's being done and how this work has to be coordinated. So we just have to figure out a way we're going to do that. And we don't have to do it, certainly, but I think we can be the leaders in doing it. So I'd like to try to work forward on how we might bring people together to have that conversation who are funding nonprofits. Thanks.
Thank you, Commissioner Somerville.
Well, since Commissioner Scott brought it up, I will just add, I also attended the field trip on Friday, and it was really great to see the work being done at everywhere from Delana Center to Ypsilanti Housing Commission, and to highlight the point of how funding is happening. I think one of the biggest takeaways for me was both that there have been some great negative impacts since the breakup of COFU. And I think to Commissioner Scott's point, even if coordinated funding doesn't come back to what it was pre-pandemic, it would be nice to know where money's going, how much less might be going to some of the housing and homelessness providers, just so others, not just us, other people making funding decisions can know that and also know the impacts. One specific detail when we were at, was it Bryant? The community center off of Platt. It was like 100,000 difference for SOS, but it impacted their federal like match ability, and it just has a lot of impacts that you don't think about, like a small, like what I think is a small amount, but the huge impacts that makes. So yes, I think more conversations. I do think that we can be the leaders to bring the gang back together to maybe just have general conversations about, okay, we did this, we walked away from this deal. What were the impacts, and were the impacts what we were hoping for? Because even though, you know, some of these agencies sit in certain parts of the county, they serve a lot of my district, to be honest. So it's had a negative impact on Ypsilanti, especially folks living in Ypsilanti Township. So it was a good experience. I think we all walked away knowing more than we did going into it that day. So I'll stop.
That's great. I'll just be clear. We didn't walk away from the partnership. We didn't. That's what I thought I heard. Just wanted to be clear. Administrator, go
Yeah.
ahead.
Just to add on to that, we are working internally, administration is working on providing you with an update on the transition away from coordinated funding to the new human services model. And we will also bring to you a new funding proposal. So those things are in the queue and you can expect to see that over the next few weeks.
And one more thing I'll add. I think that I don't, if I said that, I didn't mean it that
Maybe
way.
I misheard you. That's-
No, I didn't mean it that way. The previous partners that were coordinating, that is no longer happening, and there were some negative impacts, obviously, that we're seeing now. So that was what I meant. I think that as a organization, we are trying to pick together, the pieces, but I also think even among that, we just have broader things we need to think about as we're doing that. And the SOS detail was just one minor one that I think is super important. So that's all.
Excellent. Commissioner Robbie.
Thank you, Chair. So building off of the comments that have already been made, so I think it would be helpful for all of us to invite back the one and only MJC, maybe to give a virtual presentation on how we created coordinated funding in the first place. I think it's important for us to know where we've been, to understand where we're going. And I know that she's very busy these days and has a very high profile role, but I think her historical perspective could be really helpful. So maybe at a future working session or something like that, I think it would be really helpful to hear that. Also, MJC is Mary Jo Callan, who used to be the OCD director when she helped to create coordinated funding. And so the other thing that I would think for me personally would be helpful, because I know more of the past story. What I don't know is what happened in the last 6 years and how coordinated funding fell apart. I want to have like an open discussion about that because I feel like there's been a lot of interpersonal discussions and like rumor mill type things, people saying this happened, that happened, this happened. I want to get it all out in the open and like have an honest discussion, like what the hell happened and understand, because this is like real bad for our community. And a lot of people are suffering as a result. And everybody's like pointing the finger at other people. And the chair is right. I mean, we didn't walk away from anything, but I want to understand what happened, why it happened. And I think that will help me, whatever your recommendation ends up being, reminding ourselves how we got to where we are and then what fell apart, I think is going to help to guide me as a decision maker moving forward.
How to make that conversation happen. Certainly this boardroom might be the appropriate venue for that to occur. But again, I just want to lean into the chair's comments. We have not walked away from coordinated funding or the new human services partnership. And in fact, this body has added additional resources to that from a programmatic perspective. So I think it's important that we continue to push that narrative out as well. A lot of the dialogue that's happened in this boardroom has focused, rightfully so, on the decrease in funding for those programs, but that didn't come from this body. And I think it's important that we continue to do that. I'd also add that we are continuing to engage with those partners. In fact, I will be touring Ozone House, I believe it's tomorrow. So I continue to make my rounds and continue to talk and listen to those partners that we have had a long relationship with. And it's my hope that at some point we can bring some of those original funders back to the table in a meaningful way. And there are some specific reasons for many of them stepping away. And I think that conversation might be helpful for us moving forward.
All right, Commissioner Labar.
I was denied a spot on that tour because of quorum reasons, but I tried. Without belaboring the issue, I would just say, one, I think getting MJ back would be great, if for nothing else than to hear some of her perspective back from 2009 and 10. Commissioner Scott made a point that I think should be highlighted. The entities that were in coordinated funding that stepped away, they still continue to fund some level of human services in certain areas. And to me, that highlights the need that Commissioner Somerville talked about in terms of, if we don't coordinate funding, let's at least coordinate spending. And I think that can be done in a way that doesn't deconstruct, let's just be candid, some of the emotional fallout of the dissolution of coordinated funding, but helps us focus on what's the next iteration. And the further along we go, the further I think eventually we should get to a two-track answer. One is standing up something in place of coordinated funding, and two is giving New Human Services Partnership the support and the sustenance it needs to try and demonstrate over that 5-year period some real needle moving. And so I would, throw my hat in terms of wanting to be involved in that. And also just candidly saying, the county should always have the primary role around human services because we have the primary responsibility. And when stuff hits the fan, ultimately it comes back to the county. The state says you're small enough and nimble enough to do it. Municipalities and nonprofits say you're big enough and coordinated enough to do it. So I say, let's jump into that discussion. I look forward to it. And I am not sore about being denied a spot on the bus, but I won't forget it either. So thank you, Chair.
Commissioner Sanders, Administrator Dale.
Chair, I do want to lean into something that Commissioner LaBarre said, because I think it's an important point, and I don't want this body to lose sight of it. As we've moved through this process and we've moved from coordinated funding to the new human services model, one of the things that's most important with this new modeling is the data and metrics that lead us to a conversation around proof of concept. And to this point, we've talked about return on investment quite a few times tonight. It has been a regular item of discussion in this boardroom. And I would just encourage this body to make certain that as you allocate resources moving forward, that you're doing it in a manner that has some data to support what you're doing, and that we move down a path that moves us to proof of concept. Because otherwise we are just allocating resources. And I think that's the biggest value or the biggest takeaway from the new Human Services Partnership, and I don't want us to lose sight of it.
I hear that, Commissioner Sanders.
So I think that there is information that it seems as though we've received after the fact. I think when you're asking for funding, you should come prepared to meet any objections. And I don't see that that has been part of the process necessarily. And this is just it has appeared to me to be sort of the sky is falling. The sky is falling. The sky is falling. But nothing in between that says we need this. And if we don't get this, then this is going to happen. It's after the fact. Coordinated funding has gone away. It's done. But we're still kind of crying over it. It's time to move on and figure something else out. But also, and I said this, I think at the beginning of the year, we have a racial equity office that should be embedded in any and all of these asks. And I think that the nonprofits need to be as absolutely transparent as possible. And it may sound offensive, but poverty is an industry. I'm not saying that people are not trying to eradicate it, but it is an industry. And so we also need to look at what are we doing to change the narrative, to help lift as many people out of the process and keep them out of the process as possible. So human services is important. I was on that tour as well. I'm just not certain that some of my questions were really answered. It's kind of like a what happened the other day discussion. we're talking about what's going on right now. And we seem to be the responsible party, but also taking the brunt of the discontent. And I don't hear a whole lot of talk about the other partners that for whatever reason decided that they wanted to go another route with their funding. So.
All right, before I get to Commissioner Somerville for a round two response, does anybody else have one that didn't speak yet? Nope, or nope, Commissioner Somerville.
Thank you, Chair. Just to follow up on the last point that you made, Administrator Dell, I do want to add to the conversation, and hopefully I'm not alone in thinking this way. There are certain things that I think, while I would hope that one day we won't have to continue to fund them and have those agencies exist, we all participate in capitalism. As somebody who grew up like in deep poverty, I would love to live in a world where we don't have a crisis right now where families are homeless. I would love to live in a world where next winter, we're not facing a situation where we're not gonna have enough beds for overnight emergency shelter. So when it comes to emergency and rapid rehousing and dealing with homelessness, or when it comes to food insecurity or youth programming, I would love to think that those areas are not something that we should always be funding, or that we need to see a return in investment. But honestly, like sometimes just like, even if things just stay kind of level where they're at, that is a return in investment. So I just want to make that clear, even if it seems like nothing's happening. For example, with youth agencies, the state of Michigan has divested so much in things like literacy over the last, several decades, and it's not our fault, but like, we need to keep funding those programs because otherwise kids are going to end up in prison, to be honest. So I would love us not to have to do that. But when we're talking about this, like to me, what I see when those partners walked away, not us, when those partners did, more kids are going to go to prison.
Go for it.
The commissioners, I think it's a both and. So yes, we shouldn't always talk about things with business terms, particularly when we're talking about trauma in our community. But we also shouldn't ignore it. And I'd also say to you all, let's not lose sight of when we were in a sheltering crisis in this community, the county stepped up. When we had a sheltering crisis for our domestic violence survivors, the county stood up. The food insecurity conversation that we had 18 months ago, it was the county that stood up. So I think it can be a both and. We continue to be the safety net of the community. It's part of the core of what we do, and we do it very well. My concern is that if we are not, as a community, going to work together on these items, we're never going to have enough money to eradicate some of the things that we talk about so often in the community. It's great to talk about partnership, and it's a better conversation for some in this community when we talk about partnership with the county's money. I just think there's a better path for us.
Mr. Scott.
Administrator Dill, you took us right back around to the initial point that I just wanted to make in the news for current and future discussion. I want to applaud everybody at this table who did work to try to think about how we got more money into the community and how we did that. I think we did really important work. I think we are thinking about money that we're working with a new human services partnership to address some of the issues that we can see coming down the pike in terms of housing and homelessness that I think are going to be really important to address as we go forward. Well, my suggestion wasn't to say that we need COFU back or that we need to take on the work. My suggestion is that we have some sort of round table to make sure that people are being funded and not cross purposes. Because it was clear to me that there were really passionate people doing work for the good of our community that is not only physically hard, but mentally and psychologically hard. And that having to think about how they are all working together and how they're all making sure that they get the funding that they need together. None of them seemed like they wanted to take funding from somebody else. They just wanted to get what they needed to get their match. If we can convene a round table to make sure that people are getting that funding in some way and do your own funding, I think that's fine. But that's what I think we need to be the leaders in. Thanks.
All right, the Commissioner Labar made the point earlier, this distinction between coordinated funding and coordinated spending, and I think I hear a lot of that with what you were saying, Commissioner Scott. I think you also said earlier that when he drops some knowledge, he feels amped the rest of the day, and I think that distinction right there was a gold nugget, and you get that one too. So hopefully you're both energized after that discussion. We're ready to go. Okay, so we're almost there. Are there any other items for current and future discussion? You did. I'm not hearing any other items for current or future discussion, so I would be looking for somebody to. No, hold on. I'm pending items. We don't have any pending items. Now I would look for somebody to move to a. Oh, that's true. Okay, support. All in favor? All right, we are adjourned.